very pleasant morning to all. We warmly welcome all the participants for this CPD. Participants are kindly request to complete your registration process and have your tea. Thank you. Participants are kindly request to have your tea.
जेनो हेल्थ देता है जेन्युइन मेडिसिन पर 60% तक की बचत। अब इस बचत के साथ जेनो आ गया है
मोटिवेशन 100%. उद्या करूया परफॉर्मन्स तरीही 70%.
कारण पोषणाची कमतरता रोजच्या जेवणातून मिळतात फक्त 70% विटॅमिन्स आणि मिनरल्स. बाकीच्यासाठी नवीन सुप्रडिन डेली 5 पट झिंक आणि 12 विटॅमिन्स सह, म्हणजे अधिक एनर्जी आणि इम्युनिटी.
जेवणासोबत एक सुप्रिडन डेली.
If you were born between 1980 and 2000, तो Axis Max Life लाया है एक सॉलिड टर्म
Hello, hello. Hello. Good morning, everyone. The following participants are requested to go to counter number 4. Sunita Gavit, Ravit Ga. Hello. Sunita Gavit, Ravit Gavit, Anandi Gavit, and Seema Rathod. Kindly report to the counter number 4. Good morning, all respected dignitaries and all the participants. Now it is time for pre-test. Participants are kindly requested to scan the barcode on the screen and fill the pre-test form. After this, we'll begin with our sessions. Volunteers, kindly help. You can use Google Lens for the scan.
छोट्या जिंकींसाठी अस्सल हापूस आणि रसाळ आंब्यांचा माझा होऊन जाऊ द्या.
जेनो से दवाइयाँ खरीदना शुरू करते ही मम्मी का 1500 का बिल सिर्फ 600 का हो गया, क्योंकि जेनो मिडल
Good morning, everyone. A very warm and pleasant welcome to all respected dignitaries, esteemed speakers, faculty member, and dear participants. My name is Vishakha Patil, and I am the faculty of Riddhi Vinayak College of Nursing. I feel truly honored and privileged to be the host for today's program. At the outset, I would like to extend a special thanks to respectful, wonderful, and we welcome to our distinguished dignitaries present with us today. Dr. Venkat Goel sir, Director and President of Riddhi Vinayak College of Nursing as well as Riddhi Vinayak Multi-Speciality Hospital. Sir is renowned cardiologist and continuously guided support us in a both academic and non-academic program. Who could not attend this program, we remember him as well. Dr. Madhvi Goel ma'am, Vice President, Riddhi Vinayak Multi-Speciality Hospital and Riddhi Vinayak College of Nursing. Ma'am is out of station, but we remember ma'am as well. Now we are truly honored to have us with respected Dr. Aparna Sankhe ma'am, observer of today's CPD program from Maharashtra Nursing Council. On behalf of everyone present here, I extend a warm and cordial welcome to you, ma'am. Now I request Dr. Aparna Sankhe ma'am to come on the stage, and I also request Professor Dr. Anupama ma'am to felicitate Dr. Aparna Sankhe ma'am. We welcome you, ma'am. As we gathered here today, let us begin this auspicious occasion with the traditional lighting of lamp. Lighting of lamp symbolizes the victory of knowledge over ignorance and journey from darkness to enlightenment. As saying goes, a single lamp can light thousands of lamps without losing its brightness, simply when the knowledge is shared. Now I humbly request dignitaries to lamp the light.
आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापं सन्ध्यादीपनमोऽस्तु ते ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः आरोग्यं देहि पुत्रांश्च मतिं स्वच्छां हि मे सदा रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् यस्य तिष्ठेत् गृहे दीपः तस्य नास्ति दरिद्रता शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः.
Thank you, honorable dignitaries, for lighting the lamp and spreading the aura of positivity. On behalf of everyone present here, I extend my warm welcome to ma'am. I request Dr. Aparna Sankhe ma'am Now I request Dr. Aparna Sankhe ma'am to kindly come on stage, and I also request Dr. Anupama ma'am to felicitate ma'am. We welcome you, ma'am. Kindly give a round of applause to ma'am. On behalf of everyone present here, I extend a warm welcome and heartfelt welcome to respected Professor Dr. Anupama Oak ma'am. She is a principal of Riddhi Vinayak College of Nursing. It is our privilege to have you here, ma'am. I would also like to extend a warm welcome to Ms. Dipti Dhotia ma'am, our management secretary, whose valuable contribution, constant support, and guidance are always with us. Now I request Ms. Dipti Dhotia ma'am to come on the stage, and I also request Ms. Usha Menon ma'am to felicitate ma'am. Ma'am, we welcome you. Thank you, dignitaries. You may take your seats. I also welcome Professor Usha Menon ma'am, Vice Principal of Riddhi Vinayak College of Nursing for the CPD program. Thank you ma'am for joining us today. I also extend a heartfelt welcome to all esteemed faculties, speakers, members, and also enthusiastic participants who have joined us today for this continuing professional developmental program. As Florence Nightingale said, a very first requirement in hospital is that it should do not harm to the sick. Infection control is not merely a set of guidelines. It is a commitment to the patient safety, professional responsibility, and quality healthcare. Now we move towards a special moments of today's program, the Thil Revelation. For this, I would like to request our respected dignitaries to kindly come on stage and join us for this digital theme revelation. Ma'am, please join us. Anupama ma'am. Usha ma'am. May I request everyone to kindly direct their attention to the screen. Let us give a big round of applause. So today's theme for CPD is infection control in hospital setting, strategies for the patient safety and quality patient care. Thank you, dignitaries. You may take a seat. These themes remind us that every action in healthcare, from hand hygiene to biomedical waste management, plays a vital role in protecting patient and healthcare workers. श्री गणेशाचे स्मरण केल्याने प्रत्येक शुभ कार्याची सुरुवात मंगलमय होते. Lord Ganesha is known as a remover of obstacles and a symbol of wisdom and success. To seek his divine blessings for the smooth and successful conduct of today's program, we will now have a Ganesh Vandana. I invite 7th semester BSc Nursing students for Ganesh Vandana.
सूरनिरागसः गणपति सूरनिरागसः शुभनयना करुणामय गौरी हर श्री वरद विनायक ओंकार गणपती अधिपति सुखपति छंदपति गंधपति लीन निरंतर हो लीन निरंतर हो गणपति सूर निरागस हो
Thank you, students, for creating a divine ambience. Now we begin the first academic session of today's CPD program. The topic of this session is Introduction to Infection Control Standards. Infection controls standards play a crucial role in maintaining patient safety and preventing hospital-acquired infection in healthcare setting. It is my privilege to introduce our first speaker, Professor Dr. Anupama Oak ma'am. Ma'am has completed her master's in obstetrics and gynecological nursing from SNDT Women's University and is also a PhD holder. She has 24 years of teaching experience and 12 years of clinical experience at KEM Hospital in various departments, making a remarkable 36 years of professional experience in the field of nursing and healthcare. Madam's academic achievements are truly remarkable. She has total 114 research publications, which includes 100 international publications and 14 national publications. In addition, Madam has actively participated in 191 international and national conferences as a keynote speaker, organizer, as presenter, reflecting her strong dedication to academic and excellence and professional development. Madam has been serving a principal of Riddhi Vinayak College of Nursing for the past 5 years, and prior to that, she worked at KDA Nursing College for nearly 15 years. She also served as BOS member at Maharashtra University of Health Science, coordinator of Foreign Exchange Program, and is currently a PhD examiner and PhD guide at MUHS, Rajiv Gandhi University of Health Science, and JJT University, Rajasthan. Madam has been member of various committees of MUHS and is also associate with the Maharashtra Nursing Council for various academic and professional activities. With such tremendous experience and expertise, we are truly honored to have her with us today. I kindly invite Dr. Anupama Oak ma'am to deliver her expert talk. Please give a round of applause. Over to you, ma'am.
On है ना? You be here for the shifting the slides so that I will someone. Good morning, one and all. With positive note of Miss Vishakha, I'm starting my session with happy mood. I can say everybody's happy here, energetic. Yes, thank you. So I'll start my session with infection control in hospital setting. So starting with definition, infection control refers to policies and procedures used to minimize the risk of spreading infections, especially in hospitals, human or animal healthcare facilities. It is nothing but the invasion of the body by pathogenic microorganisms and their multiplication, which can lead to tissue damage or diseases. So everybody must be knowing what is infection. I'll move fast. So types and sources of infection. So according to the microorganism and system wise, if you see, so according to the microorganism, you can see bacterial infection. It can be Streptococcus, staphylococcus, and viral you may be knowing herpes simplex, cytomegalovirus and HIV virus. If you see the fungal infections, it can be skin and mucous membrane and protozoal toxoplasmosis. And system wise, everybody must be knowing central nervous system infections are very common. Then respiratory system, cardiac system, gastrointestinal system, urinary system, musculoskeletal system and lymphatic system. So every system gets affected when there is a infection in the body. So if you see the sources or causes of infection, it is more over the same. It may be why these infections are causing. Maybe because of contaminated medical devices. Maybe if you are using some catheter, invading catheters or ventilators, or poor hand hygiene by the staff. That is why you must have seen every hospital there are the pictures of hand hygiene near the wash basins. Contaminated surfaces. Then patient's own flora. Patients, then healthcare personnel and practices like not wearing sufficient protective equipments, environmental sources, then patients related factors, then inadequate waste management, contaminated food, antibiotic resistant pathogens, so and improperly maintained water system. So if you see these sources or causes, these are directly, indirectly involved in getting these such type of infections. If you see in this picture, you will see where are the sources of infection. If you are touching the OT lamp or OT table or lockers or all the electronic gadgets which are into the that patient area or patient's cabin, even this monitor, ventilators. So these are whichever articles we are using for the patient or whichever it is available for the patient. So these are the modes of transmission of infections. If you see the preventive aspects, now we are going to see preventive, curative and promotive. Everybody must be knowing preventive means before occurrence of the disease. Promotive means after the occurrence of disease we are treating with the medicines or by medical treatment or surgical treatment. And promotive means in future it shouldn't happen, that is why we are using this promotive treatment. So preventive aspects, everybody must be knowing to prevent infection what we are doing. We all are doing hand washing, washing hands, protective barriers. We are wearing gloves, eyewears and gowns. Then instrument processing. Currently, every hospital, they have a different process system at the CSSD. They have a inlet area different, processing different and dispatching material to different department. There are the different types of lifts. Lifts are available. So you can see the different process of instrument handling. Then housekeeping, keep the facility clean. So facility housekeeping also there are different protocols and policies. Waste disposal also, properly dispose of waste. Linen processing, for linen also the same thing. Wherever what you can say, infected materials coming to one side, used material come to from one side, or processing from one side. I mean there are the different zone of managing linen department. And then use and disposal of even sharps. It prevents injuries with the sharps. So we have to be careful when we are disposing the sharps. So if you see the curative aspects, here we require the medical intervention. When we are going for medical intervention, there are the three aspects like antibiotics, antiviral and antifungal and antiprotozoal. So if you see the antibiotics used specifically for bacterial infection, this works by either killing the bacteria or preventing them from reproducing. So whenever they are having any kind of infection, doctor will start with the antibiotics first. He will try antibiotic. But when he will start with the antiviral, it is essential for treating viral agents where antibiotics are ineffective. When it is ineffective, then doctors will go for the second line of planning or action. They show the disease progression and support the immune system. Antifungal and antiprotozoals, in that it targeted treatment for fungal and parasitic infections. Now clinical management and source control. In that you must know source control, early recognition and sepsis management, antimicrobial stewardship. So when you will see the source control, physical interventions such as draining on abscess or removing a contaminated medical device to eliminate the focal point of infection. This is coming as a source It is a kind of source control. When we'll go for the early recognition and the sepsis management, timely diagnosis of severe infections allow for immediate curative action, including fluid resuscitation and administration of vasopressors to maintain the organ function. So early recognition is very important in this clinical management, and antibacterial, antimicrobial stewardship, which is every hospital has their own policy of maintaining this. So here it is ensuring the right drug is used at the right dose and for the right duration. This prevents treatment failure and the development of the drug resist superbug. Now, curative isolation and outbreak management. When we'll go for the targeted treatment and monitoring, placing an infected individual in control environment allows for specialized care such as negative pressure ventilation for respiratory infections, ensuring the patients receive the necessary treatment by preventing secondary infections. So that has to be taken care of. We have to do proper target the treatment and monitor accordingly. Outbreak investigation. If an outbreak occurs, practitioners work to identify the cause and cure the environment by rearranging condition to prevent further progression. Next. Now promotive. Now already preventive aspect we have covered. Promotive we have done the curative also. Now promotive aspect, it focus on how we can prevent further kind of infection. So every hospital, every department must have their policies, protocol and SOPs. So in that policy you must be knowing what is policy. It is high level preparation of policy, and that has to be implemented by second level and third level and the grassroots level. So that is the policy. That policy will be one general statement of the hospital. You must be knowing, suppose in our hospital, suppose if I say, we have a policy that if the outside admission is there in our hospital, we'll make sure that we will change the urinary catheter if it is there, we will change the IV cannula, and we will put the date of that when we have changed. So that is our policy. Or sometimes they may be having policy that we will not allow the outside patient, those who are very critically ill. That can be the policy. But what is protocol? So it is the guideline, or this is given step by step direction to the healthcare workers how they can proceed further. And the standards. These standards are, NABH has given the different standards. There are infection prevention and control. There are total 8 standards that we'll see later on. What is SOP? You must be knowing standard operating procedure. Every department there has to be some SOPs. Like NICU, there will be separate SOP. In casualty, there will be different SOP. Then in if you see in emergency ward ICU, OT, every department has different SOP, and it has to be in written form, and it has to be updated. These procedures and SOPs has to be done appropriately. Revision for this, it has to be updated. Then develop policies, procedures and standards. Strengthen the community participation and intersectoral collaboration. So we can have a collaboration with other agency or organization to upgrade ourselves. Reorient healthcare services. Provide infection control education and information. So education always, nursing education or in a hospital setting, nursing educator role is it's a tremendous, very you can say dedicated, and they are really giving the education time to time to the hospital staff. Then building an accessible and supportive environment for the workers to work in that environment. Use research, monitoring, evaluation of infection control findings to inform the development of infection control interventions and re-evaluate their effectiveness. A comprehensive approach that identifies all the determinants of infection control should be adopted. So infection control, role of infection control nurse is a meticulous, and she has to be very much good vigilance, and she will find out which are the need of the giving education, which are the points has to be taken for the education, and that will be taken time to time to upgrade their knowledge. So that is why we are saying it is a comprehensive approach. Appropriate methodologies must be employed when they are using such approaches. Now we'll see defense against infections. Everybody must be knowing natural defense and acquired. Natural means whatever we have in our body, like mucous membrane, skin, that is a natural defense against the infection, and acquired means it is lifelong, it is happening later on. Next, it is acquired. Then pattern of infection, localized infection, that is microbes enter into the body and remains confined to a specific tissue, means it is enter and remain to that particular area, it is called localized infection. Systematic infection means when it is spread to several sites and tissue fluids, usually in the bloodstream. When it is going into the bloodstream, we call it as a systemic. Focal infection, when infection again breaks loose from a local infection and is carried out to other tissue. Mixed infection means several microbes grow simultaneously at the infection site. Primary infection, it is the initial stage of infection. Secondary infection, another infection by a different microbes. Now we are coming to the actually definition of infection control. Why I told you this basic information I have given, so simple to complex only I can go. That is why I told you what is infection, which are the common sources and which are the types and of infection. Now I am coming to the main point, that is infection control definition. So according to the NABH, it measures practice by healthcare personnel to prevent spread, transmission and acquisition of infection between clients, from healthcare providers to client, and from client to healthcare providers. Now infection control in a healthcare facility is the prevention of the spread of infection microorganism from patient to patient, then patient to staff member, then staff member to patients, and staff member to staff member. So these are the vicious circle is going on, so we have to take care of it. Now you can see this where are those area, you can see on the wall side chairs, then on the floor. So you can see microorganisms are available everywhere. So nosocomial infection means it is also known as healthcare associated infection, refer to infection that are contracted within a hospital or healthcare setting and manifest 48 hours or more after a patient has been admitted. It is hospital acquired infection. So when it is infection is happening, so how to control it? So there are the two aspects of it. One is standard precautions. So here standard precaution means like standardized protocol we are following out. It is a set of infection control practices. So directly we cannot do any practices without having any SOPs, guidelines and protocols. So everything is standardized. So it is a set of infection control practices used to prevent the transmission of diseases that can be acquired by contact with the blood, body fluids and non-intact skin. Everybody must be knowing what is intact skin and what is non-intact skin, and mucous membrane. And additional precaution means these are the precautions which are taken along with the standard precaution, which include airborne, droplet and contact prevention. We'll see in further slide, next slide. Now steps of standard precaution, this is also known as hand hygiene. It has to follow particular steps. For that we are going to have different demonstration that I will skip this slide. Now personal protective equipment, everybody must be knowing, head to foot we have to protect ourselves. So full personal protective equipment contains hair cover with the cap, eyewear, mask, gown, apron, then gloves and shoe cover. Okay, next. Then sterilization and decontamination and cleaning. So sterilization is a process intended to kill the microorganism. Four main ways of sterilization. Number one is autoclave. In that high pressure steam we are using it. Then second one dry heat, that is in that we are using the oven system. And third one chemical sterilant such as glutaraldehyde or formaldehyde solution we are using for such chemical sterilization, and radiation by physical agent. There are different companies, they have different agents. Now decontamination, it is a reduction of number of microorganisms of an object or surfaces. So always how we'll do that, it is less effective than the decontamination, it is very less effective than the sterilization because it does not kill the bacterial endospores. This uses liquid chemical at room temperature on object or on surface for killing the bacteria. Ultraviolet lights are also used for disinfecting the patient room after their discharge. Now everybody must be aware, wherever you are working in in corporation or government or corporate sector or private sector, whenever any patient is discharging, we have to get ready that patient unit by using particular solution, liquids and particular disinfectants. Then only we can get ready for the next patient. So it has to be there every hospital after discharge, so it has to be get ready. So there are certain ultraviolet lights are there where we can use for disinfection. Now cleaning, it is a process of handled by the housekeeping department of the hospital for the regular and routine cleaning of all surfaces for maintaining high level of hygiene. In the what happened, again I'm telling you, every hospital has different types of disinfectants and they are using as per their policy, but make sure that it is cleaned 2 hourly, 1 hourly, and depending upon the high risk area, low risk area or common area. So that is how we have to segregate your disinfectants. Now waste management, when we are talking about a waste management, it is a collection, it is a process of, we have to collect that material. Waste management, it is a collection, transport and processing or disposal, managing and monitoring of the waste material. So anybody cannot handle, and you cannot go and pick up anything. There is a particular kind of process. So the process of waste disposal are to reduce the hazardous nature of the waste, to reduce volume of the waste, and to prevent misuse or abuse of waste. Sometimes people are picking up whatever that we have disposed of and then they are doing again reusing it. So sometimes they are misusing and abusing of this waste to ensure occupational safety and health, because sometimes if they are picking up anything whatever they want, they may get cut if there are the sharps inside or needle inside. So it will cause again patient problem or those who are handling these materials. Now I'm coming to the general waste management and the biomedical waste management. Initially we are having one speaker who is going to speak on the waste management treatment, but here I will just in one slide nutshell I will just explain you how it has to be. So general waste, in that empty bottles, then discarded papers, then what is that, carton boxes of medicine, empty plastic bags, containers, wrappers, everything has to be recycled. So it's for recycling we have to put into the black container. Then food waste and vegetables, fruits, whichever leftover food, papers, eggs, eggs, shells, etc. All related with food we can dispose into the green basket, green container. Then next we'll see, that is about the general waste. General waste is black and green. So black I told you, and the green is completely related with the food. Then we'll see the biomedical waste. When we are talking about the biomedical waste, in that human anatomical waste, fetus, dressings, plaster, then blood bulk, chemicals, medical and surgical masks, N95 masks, head cover, cap, disposable linen, gown, non-plastic or semi-plastic plastic, overall, then diapers, sanitary napkins and items soaked with the blood or body fluids. Expiry or discarded medicine also will go into this yellow, and cytotoxic drugs which are very toxic to the human body, it is very dangerous, and lab waste, everything will go, all this material will go into the yellow container. Then we'll see the red container, in that recycle infected waste, goggle, whichever it is going for the recycle, then infected waste, goggles, face shield, then flash proof apron, this hazmat suit. What do you mean by hazmat suit? So it is like it prevents the toxocytic effect or biohazardous. It prevents biohazardous material, so it is completely full suit is there. So whichever the toxic chemicals are there, that the healthcare workers will not have any problem. So every hospital must have the hazmat suit. Then knitting leg gloves. That what is that knitting leg gloves? Knitting leg gloves. What is the knitting leg gloves? Are you aware about it? Latex gloves and the knitting leg gloves. So latex gloves are made up of the simple elastic rubber, and the knit-leg gloves are made up of the what you can say, non-synthetic material. And these latex gloves are preventing the person, healthcare workers, those who are wearing that gloves, from the bacterial infection and the viral infection. But this knit-leg gloves will prevent, it will not prevent the bacterial or viral infection. Basically, it is used in the laboratories to prevent the contact from the dangerous chemicals. And these normal latex gloves are fitting to your hands, but these other types of knit-leg gloves are not fitting to your glass. Basically, it is and it is puncture proof, so you will not get any needle stick injury. Basically, it is used in various big companies, laboratories, and in hospital we are using the latex gloves. Then we are syringes without needles, tubes, catheters, then euro bags, drinks, IV sets bottle, vacuotiners, everything we are going to put into the red container. Then glasswares, ampoules, vials, metallic implants, it will be put into the puncture proof or leak proof box with the blue marking. And sharps items, blades, broken sharps, syringes with needles will put into this puncture proof container. Hello? Yes, next line. Next. Okay, now we'll go to the next additional transmission based precautions. So airborne precautions, droplets or dust particles containing infectious agents can remain suspended in the air for long period of time. Air currents can flow them from them long distances. Can be emitted during talking, sneezing, coughing, whispering. Examples like measles and chickenpox. So there is the source, airspace, and the receptor. So through air it is going to spread out. Next one. Droplet precautions. In that, propel short distance through the air deposited on nasal mucosa or mouth, can be emitted during talking, sneezing, coughing, and during procedure like suctioning or bronchoscopy. Example, mumps, influenza, and rubella. Then contact precaution. If you see contact precaution, in that it is the most important and frequent mode of transmission of nosocomial infection. Example, herpes, scabies, respiratory, skin, or gastrointestinal infections. Now, why infection control is important in the healthcare facility? Infection control protects you, your co-workers, then your patient and community, because you are coming from the community and you are again going to the community. So, and it is very important for the health of self and the others. Next. The most healthcare facility, many risk people are treated or care for the confined spaces. This means there are many microorganisms present. Patients will meet many members of staff who can potentially spread the microorganism and infection between the patient. There are many healthcare workers between two patients, after giving care to one patient, when they are going to another patient, they never wash their hand, or they never use the sterilium or hand rub, and then it giving the infection to the other patient. And these practices, if it is keep on going, our infection control rate will go high. Large amounts of waste contaminated with blood or body substances are handled and processed in the healthcare setting, increasing the risk of infections. Controlling the spread of infection in a healthcare facility is therefore very important. Now, we are going to the main core of this presentation. After this background, I am coming to the NABH chapter, that is 5 Infection Prevention and Control Standards. Many of them must have working in the hospital where there is a NABH accreditation is there. So IPC 1, what they are saying, the organization has a comprehensive and coordinated infection prevention and control program. Everybody must have in their hospital at reducing or eliminating risk of patient, visitors, providers of care and community. So every hospital must have their guidelines of infection control. documentation and monitoring has to be done properly, and whenever they are doing documentation, in that they have to see, everybody has to sign, all the healthcare workers, nurses, physiotherapists, doctors, they have to sign with the date. That is mandatory. Monitoring is important, that will be done by the infection control and the infection control officer. IPC manual, it has the different aims, objectives, process, activities and surveillance, procedures, etc. They have different strategies, education and evidence-based practices. Nobody will work without evidence-based practices, and because of that evidence-based practices, research are happening. Because of that we are here and we are healthy. Okay, so reference, I just want to tell you, whenever you are going for preparation of such policy or protocol or this SOP or guidelines, we have to refer WHO guidelines, CDC guidelines, SOP by National AIDS Control Program guidelines, Ministry of Health and Family Welfare, Government of India. Always Government of India, every time they are having new upgradation of the new policy. So we have to refer that, then only we can make our IPC guidelines properly. Then high risk activities, handling blood and body fluid spill. Wherever the spillage is there, we must have that guidelines in our hospital. Make sure that you are having that spillage management protocols or SOPs. Specimen sharps, exposure to contaminated medical devices and biomedical waste. So for that, how you will manage the biomedical waste, how you will manage the needle stick injury, how you will manage every aspect of infection control. Every small thing we must have SOPs and the guidelines, and that guideline will be based on your WHO and CDC guidelines and government policies. And high risk activities, I told you. Then high risk areas, OT, ICU, bone marrow transplant, CSSD, cath lab, labor room, laboratory, blood center and IVF. Whichever the high risk area, we have to be very meticulous and we have to be done proper monitoring. This is about, so IPC 1 is saying about what? Special hand washing they are insisting. Hand washing and your guidelines, documentation, and you have to have some SOP, then we can continue our process. So that is IPC 1. Now guidelines are reviewed and updated at least once in a year. So when you are doing these guidelines or SOP, it has to be updated by every 1 year, and IPC minutes of meeting updated and reviewed every once in a month. So once in a month there has to be your committee meeting has to be there and upgraded after 1 year. That knowledge you must have it. If it is not done, you have to inform to those who are senior. You have to inform it is not done. We have to get it done. So that what IPC 1 is saying. IPC officer, there has to be one doctor. It may be microbiologist or any senior doctors. We have to make that infection prevention control officer. IPC nurse, there has to be in every hospital, infection prevention control nurse has to be there, and her main responsibility is what? She has the main key role, she has to conduct her activity as per the plan and make sure that the observation, monitoring, surveillance, analysis of the report, reporting of the report, everything she has to done as a key role person. So surveillance and monitoring of healthcare associated infection she has to do. Developing and enforcing infection control policies, sterilization, isolation, and auditing compliance with the hand hygiene and PPE uses. So IPC 1 they are emphasizing on hand hygiene and PPE. That is, and they are giving training on that continuously. Training staff on aseptic technique and managing needle stick injury. We are having another session on needle stick injury. You will get a detailed information in that session. And educating on proper safe practices. Investigating outbreaks, implementing isolation precautions, and taking corrective action to stop the spread of infection. So that IPC nurse, she has to find out the root cause of infection and she has to take action on it. Overseeing cleaning, decontamination and sterilization of equipment, including monitoring of waste disposal. Even she can go and have a training on that waste disposal management. Then maintaining record on infection rates for quality improvement and regulatory compliance. Along with that, working with microbiology lab, clinicians and administration to implement safety measures. So she has to every day, morning, evening, she has to take round. She has to find out the root cause and then she can put up into the meeting. Emphasize on the hand hygiene, managing PPE, investigating outbreaks, ensuring proper sterilization, waste disposal, and educating staff to reduce the transmission. In that, she has to report to the higher authority. This is the incidence rate of this infection, COTI infection, or ventilator associated infection. She has to find out this data and report to the superior or higher authority. Next one, IPC 2. The organization provides adequate and appropriate resources for infection prevention and control. So IPC 1 basically emphasizing on hand hygiene, PPE, monitoring, and surveillance and reporting. And second is all the resources, whether in that particular department, all the article, resources, linen, everything is available or not. So in short, I have written here allocation of adequate funds. First, we have to see there has to be adequate funds from annual budget. We have that budget or not. Some places they may not have budget. So from where they will retrieve that. So we have to have an adequate budget for the infection control. Okay, annual budget has to be maintained well. Resources must be available on continual or sustained manner, that is money, material, you know that. Then adequate and appropriate PPE, soap and disinfectants is there at that department or not. Maintain an adequate inventory, PPE, gloves, protective eyewear, mask, gown, then boot, shoe, cover, cap, hair covers, we have to check it out whether it is available or not. If you are going to OT ICU, if the slippers are not there, then again there is a transmission and infection. If the cap mask is not there and students are just entering, then again it will cause the infection. So you have to be very careful. Adequate and appropriate facilities for hand hygiene in all the patient care areas. Hand rub dispensers can be installed at convenient location. So it is a responsibility of nurses. So we have to check whether it is there or not and make it available at your level, right? Availability of isolation, isolation and barrier nursing facility. And in the training program also you can have that, how we can have a isolation and barrier situation, how we can implement. Patients requiring isolation like contact, droplet and airborne shall be placed in an isolation room. Airborne cases be kept in the negative pressure rooms. Every hospital there has to be negative pressure room and the negative pressure department. We have a special department of negative pressure this department. Now IPC 3 we are going. The organization implements the infection prevention and control process in clinical areas all the time with standard precautions. So here again they are emphasizing on hand hygiene, use of PPE, respiratory etiquettes. Now everybody must be knowing respiratory etiquettes we have learned during COVID time. So that has to be followed, whether COVID is there or not, we have to follow that etiquettes. Safe injection practices, sterile instruments and devices. That is our role. Nobody will come here. Nurses and healthcare workers, we are having the active role. So we have to make sure that it has been followed well. Clean, safe and disinfected environmental surface has to be there. So whenever the night duty sister is there, they have to see the cleaning has to be done. It will be ready for the next day use. Cleaning, disinfection of equipment, prevention of needle stick injury and sharp injury. Appropriate preparation of body parts when they are going for before any procedure or before any operation, surgery. Use of disinfectant, sterile instrument is ensure. Safe injection and infusion practices like one needle, one syringe, only one time, because many time it is observed that one needle, they may be changing one needle, but one syringe they are using for many patients. So it will not be done. Appropriate antimicrobial uses policies established and documented. Implementation of antimicrobial stewardship program and monitoring the use of antimicrobial agent. So we have to be very meticulous about this stewardship program. Corrective and preventive action to be taken and documented, that is called as a CAPA. So everywhere we have to find out again root cause and take the preventive action on it. Then IPC 4, the organization implements the infection prevention and control process in support services. So only we alone cannot work. Only nurses or we cannot work. So we require the support system. Along with that, so what we require, the design the patient, we have to have a design of patient care area, optimum spacing between the beds, in between the two beds, it has to be 1 to 2 meters. Zoning of OT, those who are working in OT, they must be having different zones of operation, entry zone, sterilization zone, then scrubbing zone. So we have to give proper label to that. Air quality and water supply with water quality has to be maintained well. Handling issues related to the air conditioning plant and equipment maintenance, cleaning of air conditioning ducts and filters, that has to, we have to check. Though we are not doing, we have to take the help of the support system. We have to check as a nurse whether it is done or not. Air handling units, cleaning of cooling towers, replacement of filters, prevention of fungal colonization. So it's our duty to whether it is done or not, we have to maintain the register for every activity. In every department there is a team leader or nurse officer, responsibility is very prominent over here. We have to emphasize on all these activities. The organization adheres to housekeeping procedure, because housekeeping also our supportive staff. So in that we have to see, follow uniform policy across different departments within the organization, use of common disinfectants. BMW is handled appropriately and safely. The organization adheres to laundry linen management process. So there, as I told you before, there has to be laundry management also has to be done properly. The organization adheres to kitchen sterilization and food handling issue. So kitchen is also the important aspect. We have to focus more on that, how they are receiving the food, how they are processing and how they are disposing of. Next. Hello, next. Fifth one. The organization takes action to prevent healthcare associated infection in patient, that is, here we have to take care of all the invading catheters. Prevention of catheter associated urinary tract infection, prevention of ventilator associated pneumonia, prevention of central line associated bloodstream infection, and prevention of surgical site infection. So here the IPC 5 is mentioning about the invading catheters, how we can treat it or how we can prevent the infection to the patient by this, by doing the surveillance of this. Next. Then IPC 6, what they are mentioning, the organization performs surveillance to capture and monitor infection prevention and control team. So in that, what they are supposed to do, the scope of surveillance incorporates tracking and analyzing the of infection risk, use of judicious mix of active and passive surveillance, risk factors analysis can be done. Surveillance is directed towards the identified high risk activities. So we have to identify high risk activity and we have to take the corrective action based on this. Surveillance data is analyzed appropriately and preventive action to be taken. Next one. In next IPC 7, infection prevention measures include sterilization or disinfection of instruments, equipments and devices. So the organization provides adequate space and appropriate zoning of sterilization activities, cleaning, packing, disinfection or sterilization, storing. The issue of item is done as per the written guidelines. Again, CSSD department also must have the guidelines, how they are receiving and disposing of the material. Reprocessing of instrument, equipments and devices are done as per the written guidelines. So every department, you remember, SOP guideline has to be established. Regular validation tests for sterilization are carried out and documented. The established recall procedure is implemented when a breakdown in the sterilization system is identified. So again, our role is coming over here. Every step, every IPC standard, our role is a major role. Next one. The organization takes action to prevent or reduce healthcare associated infection in its staff. The organization implements occupational health and safety practices as per the written guidelines to reduce the risk of transmitting microorganism among the healthcare providers. The organization implements an immunization policy for the staff. Every hospital must be having that immunization policy and they are taking that vaccines also. Hospital is providing them vaccine and that make sure that you are taking it. The organization implements work restriction for healthcare providers with transmissible infections. The organization implements measures for blood and body fluid exposure prevention. appropriate post-exposure prophylaxis is providing to all staff members. So we have to see that anybody is getting needle stick injury will not keep quiet. Immediately report to the IPC, infection control nurse, infection control officer, casualty, and don't hide anything because you will be at your risk. So it has to be noted everywhere. Otherwise, if you are hiding, you will be in trouble. Next one. So documentation, this is just last slide of mine. So document list for hospital as per the NABH accreditation. I have taken certain point where the infection control nurse, as a nurse, we have to make sure that these documents has to be there. Like infection prevention and control policy has to be there. Hand hygiene policy, guidelines, SOP for infection prevention in clinical areas. So SOP for infection prevention is support system, for example, housekeeping, laundry, and waste management. It doesn't mean ki only ward or wherever the patients are there only I will see. Housekeeping, laundry, kitchen, that also we have to take care of infection prevention. SOP of surveillance of healthcare associated infections, sterilization, disinfection policy, biomedical waste management policy, antimicrobial stewardship policy, and policy for occupational health and safety of staff. And the main important thing is we have to see that we have to be safe, and then only we can keep our patients safe. Next one. Post-exposure prophylaxis protocol. These documents has to be there with you. Hospital acquired infection surveillance register, infection outbreak investigation register, biomedical waste disposal register, hand hygiene audit register. How many times we have to maintain that registers, how many times people are doing, that also counts. Then cleaning and disinfection log for equipment and instruments, and employee vaccination register. If it is maintained intact, then you will not have any problem, and NABH, whenever they are coming, this team is coming, you will not in trouble. So if you are practicing right from the beginning, it is easy for you to go ahead. Next one. Then forms and templates, infection reporting form, hospital acquired infection data collection form, sterilization monitoring form, then cleaning schedule for the cleaning and support area, incident report form, example for needle stick injury, occupational exposure incident form. So we must have, you please, in nutshell I want to say, in every department, SOP, guideline, SOP, policy, protocols, forms, different types of form, and make sure that all the register are completed with proper, whatever near miss incidents, needle stick, whatever it is happening in your department, we have to note down. Even crash card checking, that is also your role. So whatever your role are there has to be registered and it has to be documented. Next one. Training, training has a major role over here. So training schedule and attendance log for IPC training, training material for hand hygiene and IPE uses, evaluation form for staff training on IPC. And whenever you are having training, we must have yearly that schedule with you all. And you have to maintain that this month I have done this 2 training program. You have to have that details with your whatever lectures you have taken, their attendance and their feedback form, pre-test, post-test, everything has to be documented. Next one. Then reports and analysis, in that you must have monthly surveillance report, analysis report, then compliance report, audit reports for sterilization and disinfection process, and audits for biomedical waste management. Display posters on hand hygiene infection control practices everywhere, whichever it is necessary and mandatory. Then PPE kit protocol has to be followed, and biomedical waste segregation chart, wherever that basins are there, it has to be placed. Next. We can go next one. So this is how we are ending with my session. Just 2 minutes give me. Our students are going to do one small skit on it.
Good morning to one and all present here. I welcome all the guests on behalf of Riddhi Vinayak College of Nursing students. Today, we the students of Riddhi Vinayak College of Nursing will be performing a skit on the topic of infection prevention and control. So before we start with the skit, our students have prepared a special performance. So let's begin with that.
Kirdaka junuta, dim ta. Kirdaka junuta, dim ta. Kirdaka junuta, dum ta. Dum ta na 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 na, dum ta na 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 na, dum agapa.
Dum dum da na na de ra na 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 dum dum magasa.
Ragda dum da 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 di ra na 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 na.
Da da gra da dum da da gra da dum da gra da dum 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 da na 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 de ra na 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 dum.
Kirta na di ra na. Gama gama ma gama ba ma ga sa ni sa. Kirta na di ra na. Gama gama ma gama ba ma ga sa ni sa. Kirta na di ra na. Gama gama ma gama ba ma ga sa ni sa. Come on now, follow my lead. Come on now, follow my lead. Gama ba ma gama ma. Gama ba ma gama sa. Gama ba ma gama ma.
So this performance is regarding the steps of hand hygiene. So let's begin with the skit. So let's begin with IPC 1. In this, we will see a conversation between infection control nurse and the nursing officer.
गुड मॉर्निंग सिस्टर।
गुड मॉर्निंग मैम।
सिस्टर, जो हमारे हॉस्पिटल में आईपीसी ट्रेनिंग प्रोग्राम हुआ था, क्या आपने वो अटेंड किया?
यस मैम, मैंने वो अटेंड किया।
तो उस प्रोग्राम में आपको क्या क्या सिखाया गया?
उस ट्रेनिंग प्रोग्राम में हमें काफ़ी सारी चीज़ों के बारे में ट्रेन किया गया, जैसे कि हैंड हाइजीन के बारे में, पर्सनल प्रोटेक्टिव इक्विपमेंट के बारे में और बायोमेडिकल वेस्ट मैनेजमेंट के बारे में और काउंसलिंग के बारे में भी बताया गया।
तो ये सब कुछ आपको किसने सिखाया?
हमारे हॉस्पिटल रिद्धि विनायक मल्टी स्पेशलिटी हॉस्पिटल में।
नाइस। तो रेगुलर ट्रेनिंग ये इंश्योर करेगा कि पेशेंट सेफ्टी और स्टाफ सेफ्टी को मेंटेन रखे।
यस मैम।
थैंक यू।
So IPC 1, it is regarding training and counseling, which helps in prevention and controlling the infection. In this scenario, we have seen a conversation between the infection control nurse and the nursing officer, where the infection control nurse is asking the nursing officer about the training program, and the nursing officer is answering by mentioning various training points which she has learnt in that training program. So now, next is IPC 2. In this, there is a conversation between the between the nursing officer and the floor clerk.
सर, ये मैं क्या देख रही हूँ कि वार्ड में तो एक भी सैनिटाइजर की बोतल रिफिल नहीं है।
थैंक यू मैम, आपने बताया, मैं अभी उसे रिफिल करके रख देता हूँ।
और वो लिनन का आपने चेक किया? मैंने बोला था आपको वो स्टॉक चेक करने को।
यस मैम, लिनन वगैरह सब क्लीन हो चुका है, वो स्टाफ तक पहुँचा दिया जाएगा।
और आपने ड्रग्स और उनकी एक्सपायरी डेट तो चेक करी होगी?
यस मैम, एक्सपायरी वगैरह सब चेक किया है और स्टॉक भी पूरा रेडी है, वो स्टाफ तक दे दिया जाएगा।
टाइम टू टाइम स्टॉक चेक करना बहुत ज़रूरी है, हमें हेल्प करता है इन्फेक्शन प्रिवेंशन में।
यस एब्सोल्युटली मैम, क्योंकि पेशेंट हमारी टॉप मोस्ट प्रायोरिटी है।
वेरी गुड,
थैंक यू।
So in this is IPC 2. It is regarding the availability of adequate resources. Here in this we have seen a nursing officer. She is complaining to the floor clerk about the inadequate supplies of the stocks in the ward. And here it is shown that there is importance of maintaining adequate stock, because during emergency the adequate stocks will help in preventing in saving the time and saving the life of the patient. So next is IPC 3. In this, there is a conversation between a nursing officer and the student nurse.
Hello, Miss Tanaya.
सिस्टर, आप बार बार हैंड वॉशिंग क्यों कर रहे हो?
बार बार हैंड वॉशिंग इसलिए किया जा रहा है क्योंकि इन्फेक्शन प्रिवेंशन के लिए बिफोर टचिंग अ पेशेंट और आफ्टर टचिंग अ पेशेंट हैंड हाइजीन करना मस्ट है।
टू प्रिवेंट द क्रॉस इन्फेक्शन, राइट?
राइट।
सिस्टर, आप इमरजेंसी में कैसे हैंड वॉश करते हो? क्या बार बार हैंड वॉश करते हो?
नहीं, इमरजेंसी के टाइम पे वार्ड में हर एक बेड पर एक सैनिटाइजर की बोतल रहती, तो उस समय भी हमें बिफोर टचिंग अ पेशेंट और आफ्टर टचिंग अ पेशेंट हैंड हाइजीन करना ज़रूरी है।
ओके सिस्टर,
थैंक यू।
So IPC 3, it is regarding the practices during the patient care. In this, a student nurse is asking the nursing officer about the hand hygiene practices during the patient care and emergency. Nursing officer is explaining that during emergency we can use sterilim or sanitizer, so that it will save time and it will help in saving the lives of the patient. Now, next is IPC 4. In this, there is a conversation between the supervisor and the house help.
मौसी, ये क्या कर रहे हो आप?
मैं सब साफ सफाई कर रही हूँ।
जब साफ करते हो तो ग्लोव्स पहनते हो?
जी सर, हम बराबर टाइम टू टाइम ग्लव्स भी पहनते हैं और हमें हॉस्पिटल में सिखाया भी गया है। प्रोग्राम्स अलग अलग लिए जाते हैं, हमें साफ़ सफाई कैसे रखनी चाहिए कि पेशेंट भी सेफ रहे, और प्लस हॉस्पिटल में पोस्टर्स और बैनर्स भी लगाए गए हैं जो हमें सिखाता है हॉस्पिटल की सेफ्टी कैसे मेंटेन करें।
और कितने वाटर में कितना सॉल्यूशन लेना, ये सब पता है?
जी सर, हम हमेशा 1 लीटर पानी में 100 ml हाइपोक्लोराइड यूज़ करते हैं हॉस्पिटल की साफ़ सफाई करने।
क्योंकि जब क्लीनिंग होती है उसमें अगर सॉल्यूशन ना हो तो वो क्लीनिंग का कोई यूज़ नहीं रहता है, इसलिए सॉल्यूशन अप्रोप्रिएट अमाउंट में रहना ज़रूरी होता है टू प्रिवेंट द क्रॉस इन्फेक्शन। थैंक यू।
So IPC 4, it is regarding the proper cleaning. So proper cleaning, it ensures and contributes towards the infection control in hospital. So next is IPC 5. In this, there is a conversation between the doctor and the nursing officer.
मिस गीता, आपको अच्छा लग रहा है कल से? आपको कुछ भी आज तकलीफ हो रही है? इनकी सिस्टर कौन है?
मैम, मैं हूँ इनकी सिस्टर।
अच्छा, आपको पता है ना इनको यूरिनरी ट्रैक इन्फेक्शन हुआ है?
यस मैम।
अच्छा, तो आप पूरा दिन क्या करते हो इनका इन्फेक्शन प्रिवेंट करने के लिए?
मैं सभी असेप्टिक टेक्निक यूज़ करती हूँ, और जैसे कि आपने बोला इनको यूरिनरी ट्रैक इन्फेक्शन हुआ है, इसके लिए मैं बिफोर टचिंग हर और आफ्टर टचिंग हर हैंड वॉशिंग करती हूँ, और इनका मैंने ओरल इंटेक भी इंक्रीज़ किया है, और फ्रीक्वेंटली मैं फीवर भी चेक करती हूँ।
अच्छा, और आप कैथेटर कितने टाइम में चेंज करते हो?
कैथेटर में 72 आवर्स में, एवरी 72 आवर्स।
अच्छा, गुड नर्स प्रिवेंट्स इन्फेक्शन, नाइस, कीप इट अप।
थैंक यू मैम।
So IPC 5, it is regarding the prevention of hospital acquired infection. So in this scene we have seen a hospital acquired infection of, there is a prevention regarding UTI. There are various hospital acquired infection like SSI, that is surgical site infection, urinary tract infection, then COTI, CLAPSI. So IPC 5, it is regarding the prevention of hospital acquired infection, which can be done through following strict protocols of hand hygiene and proper following of aseptic techniques. So next is IPC 6, that is there is a conversation between the infection control nurse and the ICU nurse.
Good afternoon, sister.
Good afternoon, ma'am.
सिस्टर आज कोई इन्फेक्शन केस है?
हाँ मैम, आज मॉर्निंग में ही पोस्ट ऑपरेटिव का एक केस हुआ है जिसको फीवर था। ये रहे उसके डिटेल्स, जिसमें पेशेंट का नाम, एज, देन सर्जरी की डेट, टाइम सब मेंशन कर दिया है।
और सिम्टम्स?
सिम्टम के लिए उसका टेम्परेचर चार्ट, देन टेम्परेचर स्टार्ट टाइम सब मेंशन है।
तो आपने डॉक्टर को इन्फॉर्म किया?
यस मैम, हमने डॉक्टर को इन्फॉर्म किया है और इन्वेस्टिगेशन के लिए उसके ब्लड टेस्ट, देन वुंड स्वैब सब भेज दिया है। जैसे ही लैब से उसके रिपोर्ट आएंगे मैं रजिस्टर में मेंशन कर दूंगी।
वेरी गुड। टाइमली रिपोर्टिंग ये इंश्योर करेगा कि इन्फेक्शन कंट्रोल में रहे और ज़्यादा स्प्रेड ना हो।
यस मैम।
So in this scenario, we have seen the importance of timely recording and reporting of the cases, which will help in preventing the infection and controlling them in hospitals. So next is IPC 7. So here it is the conversation between the supervisor or inspector and the CSSD staff.
गुड मॉर्निंग सिस्टर।
गुड मॉर्निंग।
सिस्टर आपने मास्क क्यों नहीं पहना है?
वो मैं अभी पहनने वाली थी।
तो सिस्टर पहले मास्क पहनो। तो सिस्टर आपको पता है आपके हॉस्पिटल में स्टेरिलाइजेशन कैसे किया जाता है इंस्ट्रूमेंट्स का?
यस सर, हमारे हॉस्पिटल के अलग अलग डिपार्टमेंट से सारे अनस्टेराइल इक्विपमेंट और लिनेन कलेक्ट किए जाते हैं। फिर उसका हमारे हॉस्पिटल के पॉलिसी के अनुसार उसका सेग्रीगेशन किया जाता है। फिर अच्छे से ऑटोक्लेव होने के बाद, स्टेराइल होने के बाद उनको स्टिकर्स लगाए जाते हैं। फिर आवश्यकता के अनुसार आप अपने डिपार्टमेंट में भेज दिया जाता है।
ओके सिस्टर, तो फिर आपके यहाँ पे इन एंड आउट प्रोसेस कैसे है?
सर हमारे हॉस्पिटल में 2 लिफ्ट है। एक लिफ्ट में सारे अनस्टेराइल इक्विपमेंट मटेरियल सब लाया जाता है और दूसरे लिफ्ट में से सब भेज दिया जाता है।
Okay, all the sterilizations has to be followed. It helps to prevent the infections.
So here it is the IPC 7, which shows the importance of sterilizing the equipment and use of sterile equipments. Strict protocols needed to be followed while sterilizing the equipments, because it will contribute in following the aseptic techniques. So now next is IPC 8. There is a conversation between the infection control nurse and the nursing officer.
सिस्टर देखो ना, मुझे बहुत डर लग रहा है। पता नहीं मैं आपको बताऊँ कि नहीं बताऊँ, बट क्या करूँ मैं, मेरे को समझ में नहीं आ रहा है।
क्यों, क्या हुआ?
मेरे को नीडल स्टिक इंजरी हो गया।
तो क्या किया तूने? मुंह में तो नहीं डाला ना?
नहीं, हमने मुंह में नहीं डाला। हमें सिखाया गया है हॉस्पिटल में कि कभी भी ऐसा चीज़ होता है नीडल स्टिक इंजरी तो मुंह में नहीं डालना है, पानी में नीचे रिंस करना है।
वेरी गुड। जब भी नीडल स्टिक इंजरी हो तो कभी भी उसे सक नहीं करना है, ना ही उसे स्क्वीज करना है। उसे रनिंग वाटर के नीचे वॉश करना है एंड पोस्ट एक्सपोजर प्रोफाइल एक्सिस के लिए जाना है।
ओके सिस्टर, थैंक यू।
So the IPC 8, it is about the safety of staff and exposure management. In this we saw about the management of needle stick injury. So here we have seen total 8 IPC. So I conclude that. So IPC 1, it is regarding the importance of education and training. IPC 2, it is about the availability of infection prevention and controlling resources. IPC 3, it is all about the practices during the patient care which we follow. Then IPC 4, it is about the role of role of support services in infection prevention. IPC 5, it is about the prevention of hospital acquired infection like COT, UTI, CLAPSI, SSI. Then IPC C, it is about the surveillance and reporting of cases to prevent infections in the hospital. IPC 7, it is about the sterilization and disinfection of the instrument. And IPC 8, it is all about the staff safety and exposure management. So we are the nurses. We play a very important role in preventing and controlling the infections in the hospital. Thank you for giving us the opportunity to performing the skit. Thank you so much.
Give a big round of applause to the students. Thank you, students, for active participation. Thank you, Professor Dr. Anupama Ok ma'am, for the wonderful and informative session. Your valuable insight on infection control standards will surely help us to strengthen our self-healthcare practices. I request Dr. Anupama ma'am to come on the stage. And I also request Ms. Dipti Dotia ma'am to offer a token of plant. We welcome you, ma'am, on the stage. Please give a big round of applause. Thank you, ma'am. Mindset of nurses related to prevention of infection. The nurse are the first line of defense in infection prevention, and the awareness and practices directly influence patients' outcome. It's my pleasure to introduce Professor Usha Menon ma'am. She holds a master degree in pediatric nursing and has also completed postgraduate counselor course from Tata Institute of Social Science. She has 15 years of clinical experience and 20 years of teaching experience. I now request Professor Usha ma'am to kindly start with the session. We welcome her with a warm round of applause. Thank you, ma'am.
I can do it here, no? मेरे इसमें है ना जो मैंने किए हैं मेरे वाले क्लोज थैंक यू सो मच काय आलं थैंक यू सो मच A very good morning to all the beautiful souls present over here. ऐकू येतंय ना झोपले नाही ना तुम्ही की छान छान रोल प्ले वगैरे झाले बरं असो बिफोर स्टार्टिंग लेट अस रिमाइंड आवरसेल्व्स हू वी रिअली आर येस सो आय रिक्वेस्ट ऑल ऑफ यू टू फोकस ऑन युअर फोरहेड आणि जे मी सांगेन ते तुम्ही प्लीज रिपीट करा रिपीट आफ्टर मी आय ॲम अ पीसफुल सोल बोला आई एम अ पीसफुल सोल मैं एक शक्तिशाली और शांतिपूर्ण ऊर्जा हूँ बोलिए मैं एक शक्तिशाली और शांतिपूर्ण ऊर्जा हूँ इस शरीर में हूँ और इस शरीर को चलाने वाली ऊर्जा शक्ति हूँ बोलिए शरीर में हूँ और इस शरीर को शक्ति चलाने वाली ऊर्जा हूँ This we have to remind ourselves. और मैं इस दुनिया में इस प्लैनेट अर्थ में अपना पार्ट बजाने जैसे रंगभूमि में जो एक्टर्स पार्ट बजाते हैं ना ऐसे भी हम हमारे पार्ट बजाने इस पृथ्वी पे आए हैं या नहीं आर यू द ट्रैवलर्स जर्नी पे है ना हम लोग तो ये हमें याद रखना है ऑल राइट सो कमिंग बैक टू आवर सेशन टॉपिक आप सोचेंगे ये क्या है माइंडसेट व्हाट इज़ दिस माइंडसेट इसकी क्या ज़रूरत है माइंड यू माइंडसेट से ही सारी दुनिया है आपने देखा होगा आजकल दुनिया में अनप्रेडिक्टेबिलिटी इतनी है बिकॉज ऑफ द नेगेटिव माइंडसेट आप देखिए वेस्ट एशिया मिडल ईस्ट क्या हो रहा है नेगेटिव माइंडसेट की वजह से इसका परिणाम देयरफॉर माइंडसेट इज़ वेरी सिग्निफिकेंट सी इन आवर लाइफ जर्नी वी नीड टू हैव सर्टन survival strategies. There are certain strategies that we learn and for which the mindset is very important. Say, let us take the example of managing time. If you want to manage time in a positive direction, again, mindset matters. If you want to manage your stress and deal with your stress, attention and strain, then to deal the tension, you need to have a positive mindset. If you want to deal your balance between the work and your house, यानी वर्क लाइफ बैलेंस आप पर्सनल मैटर को प्रोफेशनल एटीट्यूड में नहीं लाना है प्रोफेशनल बिजनेस में पर्सनल मैटर नहीं लाना है इसके लिए भी कौन आता है बीच में माइंडसेट And last, very important, resilience. यानी bouncing back from the challenging situations or even a crisis that we are into. उसको कहते हैं resilience, और इसके लिए भी हमें कौन चाहिए? A positive mindset. So keeping this in mind, आप सोचिए mindset इतना important है तो infection prevention control में mindset का कितना बड़ा role है. Okay? It is a very small but very interesting and important topic. ताकि आज हम जब यहाँ से जाएं हम सब लोग अपने mindset को positive में रखेंगे. Is it a promise? हाँ या ना? Excellent. तो ये क्या चीज़ है ये mindset? Mindset refers to an individual's beliefs and attitudes about events, people and circumstances in their life. Mindset factors into personality by having a powerful influence over the thoughts, feelings and behavior of an individual. यानी अगर अपने mindset positive है तो अपना attitude भी positive होता है. समझो अगर हम कोई बड़े से challenge में फंस गए, disaster में, मे बी सम डायग्नोसिस हो गया एकदम लाइफ थ्रेटनिंग, मगर अगर मेरा माइंडसेट पॉजिटिव है तो उससे हम बाहर आ सकते हैं. जो डरावना होता है कैंसर नाम से हमें डर लगता है, लेकिन उससे हम बाहर आ सकते हैं अगर हमारे माइंडसेट पॉजिटिव है. तो अगर मेरा एटीट्यूड पॉजिटिव है, इट विल बी सीन एंड डिपिक्टेड इन माई एटीट्यूड, इन माई पर्सनैलिटी एंड देन अल्टीमेटली इन माई बिहेवियर. So as a nurse, we should always have a positive behavior and an attitude should be positive, specifically in front of the patients who are coming with n number of diseases. It's not only physical diseases, but all the aspects, it may be physical, emotional, social, many other aspects and context are there. Based on them, they're not well, and that is why they are here, and therefore our mindset should be always in a positive direction. A positive direction, my nurse will always heal the client. The minute the client or the patient will look at a nurse who is confident and having a positive energy, वो बोलेगा मेरा आधा बीमारी तो यही खत्म हो गया है. You understood how mindset is very important. Are you all understanding? Back bench में बैठने वाले हैं, please ध्यान दिया करें. So let us see how this mindset is helping us in today's topic related to the infection prevention and control. जैसे हमारी ड्यूटी शुरू होती है, it begins with, जैसे उन्होंने बहुत अच्छे डांस फॉर्म में hand hygiene technique बताया. Yes, we should sincerely do the hand hygiene procedure when we enter our department, whichever department it may be. Hand hygiene is very important. देखिए यहाँ पे आपको कोई भी vigilance नहीं दे रहा है. Nobody is supervising you, not even God. अरे तो कौन सुपरवाइज कर रहा है आपको? आप अपने आप को. You are supervising yourself. So be sincere in whatever procedures or whatever skills you are supposed to perform. Whether anyone is looking at you, not looking at you, you be sincere in whatever you are doing. That's very important. So we begin our job with a hand hygiene. So how is this mindset affecting us? So regarding the infection prevention and control, this mindset is fundamentally rooted in a strong sense of professional responsibility. And definitely it is giving 100% commitment to our patient safety. Yes or no? Hi, Anna? So the mindset of nurses regarding infection control, it is a complex balance of professional obligation. Obligation हर चीज में होता है, professional में भी होता है ना? And therefore there is a strong desire for the patient safety and the daily challenges of a high pressure clinical environment. See, many a times what we do now, we nurses, we want to see the comfort of the patient first. तो ऐसे टाइम में क्या होता है, कभी कभी हम लोग इन्फेक्शन प्रिवेंशन कंट्रोल को हम सेकेंड बेंच में डालते थे. फर्स्ट बेंच में हम करते हैं चलो पेशेंट का कंफर्ट देखते हैं. यानी सपोज हमने सीखा है क्लीन टू डर्टी में जाना है, लेकिन पेशेंट बोल रहा है नाउ आई वांट टू एम्प्टी माय बावेल और एम्प्टी माय ब्लैडर फर्स्ट. ओके, then before introducing into some intravenous fluid, for example, I'm just telling. So how here the nurse is minding the comfort of the patient first. he or she may say, हाँ चलो भाई, let me give a bedpan and then I will wash my hands and hand hygiene हो जाएगा and then I can go ahead with my other clean procedures for maybe introduction of an IV line, etc. लेकिन यहाँ पे क्या हो सकता है? There can be potential or a future risk for the patient to get any kind of infection if hand hygiene or any compromise related to the infection prevention steps are being ignored. You understood? So let us see how our mindset is involved related to infection prevention and control. So while many nurses demonstrate good intention and high self-efficacy, this mindset is influenced by a complex interplay of individual, organizational and environmental factors that can sometimes lead to deviations in practice. As I said about the example, when a patient may request that I need to empty my bowel or bladder first, rather than introducing some other procedures which are clean in nature. So there, as a nurse, we may see to it that the comfort of the patient matters first. But then in the back of the mind, we should always remember that it can compromise and be a potential for the risk for the patients. So while the nurses generally have good knowledge and positive attitudes towards infection prevention, actual adherence can be influenced by practical constraints and competing priorities. In the sense, practically there may not be adequate resources available to practice, or maybe practically the ratio between the patient and the nurse is not maintained. As a result, the nurse is not able to provide that particular attention and care or the steps that the nurse needs to follow for each patient, so on and so forth. Okay, there can be a number of reasons. So there are certain key aspects which we need to keep in mind related to the infection control and prevention. First and foremost is prioritizing patient's well-being. That is what I said when I gave the example of maintaining the comfort of the patient first. So nurses often prioritize the immediate critical patient needs like stability and comfort over the infection prevention protocols when forced to choose due to some time restraint, or even sometimes, as I said, the resources may not be available freely as it should be. Maybe the provision of PPE, or maybe provision of gloves, or provision of hand hygiene, disinfectant, so on and so forth. There are many resources, okay, that need to be provided in abundance by the management or by the authority. Secondly, the second aspect is balancing the act. In the sense, a nurse may prioritize taking a patient off a bedpan to relieve discomfort, even if it means slightly compromising the clean to dirty workflow, hoping to manage the contamination risks with hand hygiene afterwards. But then, as I said, it may lead to or may have a potential risk for getting infection in the future. Then, very important, as we have always learned, first do no harm. This is the very important key aspect. This is the principle of primum non nocere, first do no harm. It's central to their professional identity, driving their commitment to reducing healthcare association infection, or HAI. In the sense, first do no harm. If you're not very sure about a particular step or a procedure, then you do not be ashamed or do not hesitate to ask your seniors or the experts. नहीं तो ये ego लेके बैठना नहीं, oh, I am such a senior faculty, how do I ask, how do I? So rather than performing any error, might as well take the help of the, or you should be always updated to the present steps and the present technologies. In that way, we will do no harm to the patient. Then another important key aspect is professional duty and accountability. Nurses widely acknowledge their pivotal role and responsibility in preventing healthcare associated infections. So this sense of duty is a primary motivator for adhering to the infection prevention and control guidelines, as Madam Anupama has already enumerated all them in detail, and a core component of their professional identity. Very important aspect is patient advocacy. Many a times patients are unconscious, or patients are made unconscious by anesthetizing to perform XYZ procedure or whatever. Or patients are ignorant, they don't know their rights. Patients' rights, they are not aware. So you as a nurse, you must be the vakil, the judge, the lawyer, the advocate for the patient and protect the patient's right. Okay. So a core principle of the nursing mindset is patient advocacy. This means proactively protecting the patients from harm, including ensuring all healthcare personnel follow proper hand hygiene, other precautions. Just because he or she is a surgeon or a doctor will do a smoking and will come inside without hand washing, it is a no-no. You have every right to stop them there at the gate itself and tell them, first do proper hand hygiene, then only you will enter the department. That means you are a proper advocate for your client. Then very important aspect is perceived effectiveness. Nurses are more likely to follow guidelines when they believe the practices are effective in reducing the infection risk. So the perceived severity of the infectious diseases, such as during a pandemic, we all have experienced for 3 years, yes, during corona, yes, and also heightens the adherence to protocol. So हमने देखा कॉमन मैन लेमैन भी उनको पता है कैसे ह्यूमन टू ह्यूमन जो टच नहीं होना है, कैसे सेफ डिस्टेंस रखना है, कैसे मास्क पहनना है, कैसे क्राउड को अवॉइड करना है, कैसे अननेसेसरीली ट्रैफिक या ट्रैवलिंग नहीं करनी है, all that. And we want to cough and sneeze and all, how to follow and how to cover your mouth and nose, all that we have learned, and every now and then disinfecting with the solutions. Okay, that was available for all 3 years we did it. And how even the vegetables also, we were so having some type of OCD, we want to wash it every now and then we take it to the kitchen. All that fear was there within us. That means we were, the adherence to protocol was becoming more and more and more because we are afraid that this infection can be dangerous to our health. Then very important aspect for our, not only for the healthcare sector, but even in our nursing team, and that is teamwork and peer influence. The workplace culture and the behavior of the colleagues significantly influence an individual's mindset, and it's how much we are going to compliance or how much we are going to adhere in with that teamwork spirit. So nurses often follow the herd behavior. Herd म्हणजे एक असं ग्रुप असतं, नाही काही न विचार करता ग्रुपनी जे केलं ते मी फॉलो करणार, त्याला आपण म्हणतो हर्ड बिहेवियर, HERD. Okay, so suppose if the team leader of that department is very good into following the protocols and the steps of infection prevention, definitely the newcomer, the freshers or the juniors will follow that particular team leader, and therefore the whole team will see to it that the infection is prevented in that particular department. So thus a supportive team environment with open discussion about the hygiene issues will always foster a better practice. There are some more knowledge, key aspect related to mindset of, related to prevention and control of infection, that is knowledge and self-efficacy. So most nurses, they possess adequate knowledge of infection control principles, such as the importance of hand hygiene and personal protective equipment. We have seen in that skit, yes? Provided the authorities are providing enough of these resources. So the appropriate PPE donning and doffing, these steps are very important. Donning to ठीक है, लेकिन doffing is very, very important to prevent infection to self and also to others. Okay, and then if we are very much updated with all the skills, competence, then definitely we as a nurse, we will have confidence in performing any kind of clinical skills or procedures. Okay, therefore high self-efficacy, that means confidence in the ability to perform infection control measures effectively, is associated with better compliance, with low self-efficacy. And if we are having low self-efficacy, that means I will lead more close to the infection, therefore becoming non-compliant to the protocols. That means I am going to give harm to my patient. This we have to be very vigilant, okay? Then very important aspect is knowledge practice gap. A significant challenge is translating this knowledge into consistent practice. हमें सबके पास knowledge है. हम लोगों ने classrooms के 4 walls में theory अच्छे तरह से पढ़ लिया है. सबको पता है hand hygiene is very important. Everyone knows. But how many of us practically do it in the field? So that is a big challenge. Okay, practicing and actually implementing the knowledge that we have learned. I always tell to the students, your knowledge is incomplete. You are becoming an incomplete nurse until whatever you learn in the theory, you need to convert it into the clinical area in a positive and correct step. Then only we will say that there is no gap between the knowledge and the practice. So studies show that good knowledge does not always translate into perfect adherence due to the factors like time constraints, inconvenience, or the assumption that the patient is not infected. We cannot assume. There should not be any assumption specifically related to the patient's care. There are certain factors that influence adherence, and they are from the facilitators. Facilitators means the management or the concerned authority who was going to help the nurses in any number of ways. They are called as facilitators. So for them, what are their certain factors that is related to prevention of infection, okay, and even control of infection? First and foremost is ongoing education and training. There is continuous staff education program. There is ongoing induction program. Now we have ongoing CPD, just in the name of renewal of registration. Every nurse gets updated to the various new technology and new diseases that is arriving every day in the market because of the advancement in the science. Okay, therefore ongoing education and training is very important. So regular comprehensive training programs that combine the theory and practice significantly will improve the knowledge, and definitely that will help to create compliance with our activity. So this education will help the nurses understand not just what to do, but the scientific reason and the rationale behind whatever that the steps that we do. Okay, that is very important. Then of course management and leadership support. This is from the facilitator side. Now here the strong administrative financial support from the management related to the infection prevention control is very important. This initiative must come from them. Therefore, there has to be a clear specific policies and a positive influence towards the nurses, and also nurses' attitudes, mindset के बारे में हम बोल रहे हैं. And therefore, it will help us to improve the correct practice in the clinical area. So we cannot say, अरे इतना क्यों spend करना है, resources को जरा control में रखो. No. The resources has to be ample, in numbers provided to the workers. We cannot tell to housekeeping, जाने तो बिना gloves का ही तुम mop मार लो. No, don't do that. They are also human beings. We don't want to give any kind of infection to ourselves and to the others. No, therefore, the enough number of resources must be provided by the management. Okay, then. As I said, availability of resources, easy access to the, ऐसा नहीं होना चाहिए कि सारे resources तो दिए लेकिन वो सब ताले चाबी में हैं और वो supervisor जो है छुट्टी पे 10 दिन. So you will not get it. Then what is the use of all those resources? Therefore, it should be in such a way that it is easily available for the workers as and when they require. So easy access to the essential supplies like soap, alcohol-based hand rub, gloves, gowns, masks, etc. that will make us to adhere very easily, and it will become, the care and the infection prevention step will become consistent in nature. Then very important is performance monitoring and feedback. Without feedback, we will not know the quality of our performance. So there has to be a regular audit, an observation and constructive feedback related to the IPC practices, and therefore help maintain the high standard and accountability. ये हमें हर एक को हमारे दिल में इसके बारे में जो प्रोफेशनलिज्म होता है ना, वो होना चाहिए. तो फीडबैक में सिर्फ बाहर दूसरे का फीडबैक की ज़रूरत नहीं है, हमें खुद को पहले हमारा सेल्फ इवैल्यूएशन वो फीडबैक होना चाहिए, खुद का फीडबैक. हाउ एम आई डूइंग, हाउ मेनी केसेस I gave nosocomial infection or cross infection, was my patient satisfied with the services that I've rendered, so on and so forth. Uske baad mein definitely the authorities feedback etc. and our own yearly performance appraisal everything is there, but मेरे खुद के अपने evaluation feedback बहुत ज़रूरी है, याद रखना. Then there are many barriers. हमें पता है हमें ये करना है, ऐसे करना है, नहीं करना है, but there are certain barriers, certain hindrances. काय आपण म्हणतो त्याला अडथळा, ठीक आहे. तर काय आहे ते? फर्स्ट अँड फॉरमोस्ट आपल्या इंडियामध्ये किती पॉप्युलेशन आहे त्याप्रमाणे आपल्या नर्सेसचे जे प्रपोर्शन, जे रेशो दिली पाहिजे की नाही, मेनी अ टाइम्स it is not maintained. Therefore, the nurses will feel the work pressure, the workload. Sometimes they are made to do double duty, triple duty. हाँ, कोरोना के टाइम में ये बहुत हमने फेस किया है. तो ऐसे टाइम में क्या होगा? There are chances, even though the nurse have the knowledge, is not able to perform it as he or she supposed to perform a procedure step by step. You understood? Also, time pressure. Say for example, if a nurse is allotted 20 patients, 15 patients, beyond the capacity of the, and agar critical care cases diya to bhi that person is provided 5 cases, management mein se kya lik 5 hi to diye, but for the 5 to take care and to maintain the aseptic technique, it becomes a very big challenge for the nurse on duty. Okay, so please remember, high patient loads and time constraints are frequently cited as a major hindrance or barriers, and that will lead to conscious or even sometimes unconsciously we deviate from the protocol that we are supposed to follow just to save the time so that we can give care to all the 10 or 15 cases that is allotted to the nurse. This is very dangerous. There are chances that I'm going to harm my patient. Another important barrier is inadequate infrastructure. Mumbai में जगह कहाँ है भाई? Definitely we do have this shortage of spaces and all, and आप देखोगे हर गली में अभी आजकल nursing home clinics खोले हैं. ये सब like as though I feel it is the residential block converted into such whatever commercial. So there will be a definitely inadequate infrastructure. So poor physical conditions such as lack of isolation rooms, insufficient hand washing station, or even overcrowding. Overcrowding क्या हुआ? Overcrowding of the patients, or even sometimes unwanted equipment ऐसे डाल दिए बहुत सारे, हाँ कमरे में overcrowd हो गया because of the unwanted equipments. All this can hinder, it can obstruct the effective infection prevention and control implementation, and then the nurse will feel at the end of the day, I'm not at all satisfied with the care that I gave because I know I did not follow 1, 2, 3 steps. Then very important barrier is, as we have already learned, knowledge gap. Despite generally having good knowledge, specific gaps may exist in the nurses because he or she may not be updating with the latest technologies and the techniques. आजकल आपने देखा होगा introduction of AI is there. हमारे टाइम में introduction of computer had come. It was a big challenge at time. So the elderly, seniors elderly, आता कौन करणार, कौन ABCD type करणार, who will do? But then that was how it was, and now we will see introduction of AI. That is why you will find so many robotic surgeries, etc. are happening. Now we are going even beyond the robotic surgery. So at this such technology advancement is there, and if we are not updating, definitely I'm going to have a knowledge gap, and that will lead to my going nearer to the giving infection to my patient, therefore going near to non-compliance. Okay. Then आता नवीन फॅशन आहे, हे माझं काम नाही, ते माझं काम नाही. Latest in our days, whatever the in charges used to tell, quietly we used to follow and do. But nowadays you just dare to give a job extra. How did you allot? This is not my work. That is what you will listen as a senior or as an administrator. You will hear this particular sentence. So what is happening? There is lack of role clarity. In the sense, when we are appointing, the job specification. There has to be clarity in what job you are supposed to do. If that has been provided, I'm sure such kind of role clarity lacking will not happen. But what happens because of the new technology, specifically in the infection control team, there is something called as antibiotic stewardship. Here, literally the nursing officer has to go, say for example, we'll go to the ICU and we'll actually find out when did the patient got admitted, for how many days, what was the, the investigation results, how much was the, am I going beyond the time? Oh, fine. Almost finished. And all that, the nurse has to, and the nurse will also interview the team leader or the nurse in charge of the patient. There may be conflict or clash between that nurse and that infection team nurse who is maintaining the antibiotic stewardship. So how many days this particular antibiotic was given? Why was it given? If it was a viral case, why did the surgeon or the doctor advise? All such. So the nurse will say, "Hey, mother, come, why should I?" But no, it is a new role that has been given to the nursing officer to maintain the antibiotic stewardship. So and so forth, like that if I'm not aware what is my role, there can be a discrepancy and I will say I'm not sure what am I supposed to do. For example, here since only 5 minutes have left out for me, I'll just be in a hurry. In short, I thought you all should be aware the step-by-step doffing, removing of the PPE after you assist with some infective cases, or even let us assume all the cases are as seropositive so that you will maintain aseptic technique. So here while doffing, the first for the gloves, remove the outer gloves first by grasping the cuff, pulling them inside out and discarding. Then hand hygiene, clean hands thoroughly with alcohol rub or with the soap and water. Then next is the gown or the apron. You will unfasten the ties, bend forward slightly and roll the gown apron away from your body, keeping the contaminated outer surface inward and then discard. Manje je kai blood, anything was there, it will be inside that gown and you are going to discard in that bag where the dirty linens are provided. After that, again you will perform hand hygiene. Okay, then the next comes the face shield, the eye goggle, okay. And then remove them by the straps and avoid the front and then discard or disinfect. It depends. Agar wo discardable hai, discard. If it is reused, then you disinfect. Then again you will wash hand. See how doffing has more number of steps. You have to keep it in mind. Then comes the mask. Remove the ear loops or the ties, pulling away from your face without touching the front, and then you will discard. Understood? And lastly, again, hand hygiene. You see? There are certain key principles related to this doffing procedure. Order matters. Always follow a specific sequence to avoid spreading germs. No touching. Do not touch the outside of the contaminated PPE. Hand hygiene. Perform hand hygiene after removing each item. And then forward motion. Roll or peel items away from your body to contain the container. That means you also will not get infection, neither will you spread it to the surrounding. Okay. How the influence of environment and culture. I'll just take it fast because the time is so short. First and foremost, role modeling. Experienced nurses who model safe behaviors are crucial in shaping the attitudes of newer staff. So conversely, a lack of good role model can negatively impact the adherence. Okay. And then organizational support, a supportive organization culture with adequate staffing, clear policies and accessible supplies. Say for example, hand sanitizer, PPE, supply, everything, etc., so on and so forth. It will foster a stronger infection prevention mindset and better compliance. Then very important, feedback loops. The immediate salient feedback from a patient. This feedback from the patient can be even ongoing or even after when the patient is being discharged, then he or she can, that will be a formative and a summative feedback from the patient. Okay. This will help us to go ahead in a positive manner, and if there are any more contaminated spread or something like that, then as a nurse we can take a step, we can decide how we can prevent the infection in future. What are the areas for improvement? Nurses often face organization and relation challenges such as staff shortages, as I said before, high workload and interruptions, which can lead to conscious and unconscious deviations from protocols. So the mindset is often one of the navigating a complex and shifting context where flexibility is needed to manage competing demands. So ongoing education and training programs are essential to reinforce best practices and address the barriers the nurses are facing in their day-to-day work life. Any questions, my dear audience? Thank you very much. So if with new mindset, you will definitely get a new result, and therefore will prevent the infection and control the infection in our hospitals wherever you are appointed, and the patients will be happy and cheerful and will get discharged from your hospital as soon as possible. Thank you very much. Thank you.
Ma'am, request you to kindly wait for a while on the stage. Thank you, ma'am, for the insightful, thought-provoking session. It will always help us to keep our mindset very positive. I request Ms. Manila Nair, ma'am, lecturer of Riddhi Vinayak College of Nursing, come on the stage and to offer a plant as a token of love to Professor Usha Menon, ma'am. Give a big round of applause, everyone. Thank you, ma'am. Before we continue, let us take a short refreshing break. As we all know, hand hygiene is the simplest way to prevent infection. To make it fun, our student will present hand hygiene dance. I request all participants to kindly sit and follow the same hand hygiene steps along with them. Let us active participately. Join be a part. Raise your hand, everybody. Yes, everyone, raise your hand. From back side, I'm not getting. Yes, raise your hand. Participate actively, everyone from this side. Yes, raise your hand. Very good. Show your hand is not getting visible. Very nice.
Come now, follow my lead.
You want this for once more? Okay. But you need to participate in this, okay? And everyone will raise your hand. So it should be visible like this. Yes. And keep a smile on your face. Enjoy this moment. Yes, participate. Yes, join everyone.
Come now, follow my lead. Come now, follow my lead.
Give a big round of applause to our students, and I hope you have enjoyed this refreshing activity. Thank you, students. With this, we proceed to our session 3. As it is rightly said, safety in healthcare begins with awareness and responsible practice. The needle stick injuries are one of the most common occupational hazards among the healthcare professionals, and preventing them is essential for protecting both caregiver and patient. To guide us on this important topic, I invite Ms. Flavia Diza ma'am. She is Associate Professor at Riddhi Vinayak College of Nursing. Madam has completed her Masters in Medical Surgical Nursing in CVTS from Bombay Hospital College of Nursing and has 10 years of combined teaching and clinical experience. Her expertise and experience will certainly help us to gain better understanding about prevention and management of needle stick injury. I kindly request ma'am to please come forward and conduct this session. Please welcome her with a big round of applause. We welcome you, ma'am.
Good morning, one and all present over here. We are at the session 3. Okay, I need your complete attention here. It's a very, very important session. Okay, so today we are going to deal about needle stick injury. Needle stick injury is a very common injury. It is an accidental injury which takes place when you start working at the bedside. Among all the accidental injuries, now when we are working in the hospital, we come across various injuries like medication errors are there, there's an accident. At the same time, there's falls happening. So these all are accidental injuries, and amongst them, needle stick injury plays a very important role. So a needle stick injury occurs when skin is accidentally punctured by a used needle, posing risk of blood-borne infections like HIV, hepatitis B, and hepatitis C. So as the definition says, it's an accidental injury which takes place. And if the needle is contaminated, we can get HIV, hepatitis B, and hepatitis C. Okay, we'll see the statistical data here. So in a tertiary care hospital in Eastern India, in Bhubaneswar, there were total 115 needle stick injuries were reported over 4 years. That is from 2019 to 2022, equating to roughly 29 needle stick injuries per year in that institution. Then a study was conducted at Baba Atomic Research Center Hospital. Over a 3-year period, a total 56 needle stick injury cases were reported among the healthcare workers. And as per the Occupational Health Survey, among 258 healthcare participants, including the doctors, nurses, lab technician, about 68.6% had a history of experiencing at least one needle stick injury over their careers. So you can see here the statistical data tells us that there is a rise in the needle stick injury cases. Okay, so what can be the causes? The causes here is, first is unsafe disposal of needles. Example, overfilled sharp containers. Okay, if the sharp containers are filled, the class 4 worker should make a point to at least empty it and get it changed every time. And sometimes, while you're working in the wards, you keep the syringe near the bedside locker, or sometimes it just remains in your tray. You should make sure that you discard it soon as you finish your work. Next is recapping of needles. As everyone knows, recapping of needle is now prohibited. We should not recap it. Each and every nurse carries a tray, and in that tray, every hospital provides a small needle cutters which are available now, and they have to carry the tray along with the needle cutters, and whenever your work is getting over, then and there you have to cut the needles, and there the disposal happens. So with this, you will avoid the injury. And third is passing instrument from hand to hand in operating rooms. So when you're working as a OT nurse, you know when you're handing over the instrument to the surgeon, what you do is sharp side is towards you, okay? So the sharp side is towards you and then you are handing over the instrument. But you have to see that when the sharp side is towards you, you should not injure yourself, okay? Now we'll see who is at the risk of getting the exposure. Okay, the main risk is the exposure of the healthcare worker to bloodborne infections like hepatitis B. Hepatitis B, as everyone knows, it's a liver infection which happens and it is transmitted through body fluids. Next is hepatitis C. It causes liver inflammation and spreads through direct blood-to-blood contact. And the last one, HIV, that is human immunodeficiency virus. As everyone knows, it attacks our immunity system and breaks down our immunity. Now we'll see who are at risk. So the category 1 are employees whose duty include routine or reasonably anticipated exposure to blood or body fluids. So those employees who are in constant contact with the patient, those include nursing staff, then is dentist, physicians, lab personnel, and direct care staff. Direct care staff are all the class 4 workers working. The lab personnel, as everyone knows, they have to do daily blood collections. So these are the category 1 people who are in direct contact. Next is category 2, employees whose duties include infrequent anticipated exposure. Means they are not frequently exposed, but infrequent anticipated exposure is there. In that they include laundry personnel, teachers or instructors, ECG or EEG technicians. Then you have PT, OT, RT, that is physiotherapists, occupational therapists, and respiratory therapist personnel. These are the category 2 clients here. Next is category 3, employees whose duties do not include routine or reasonably anticipated exposure. Okay, so their duty doesn't include direct exposure. In that we have dietary staff, clerical staff, pharmacists, and non-nursing department heads, that is administrative staff. Okay, till here everyone has understood? Okay, here. Next is prevention of needle stick injuries. First is hand washing thoroughly with a disinfectant soap and running water. Do not squeeze. I repeat, do not squeeze. What is the rationale? What is the reason behind not squeezing it? First is when you squeeze it, you apply pressure. And once you apply pressure, the area near the prick, you know, there is a bursting of the blood vessels there. And once the blood vessels are bursted, the infected needle containing the virus can spread throughout the body. And that is why this custom of squeezing is outdated. First they used to squeeze it, but now the protocol says do not squeeze it. Next is obtain the history of vaccination. Third one, if vaccinated, check the antibody titers, and if they are adequate, no treatment is necessary. And next is if not vaccinated and the source is either positive for hepatitis B or HIV or hepatitis C, refer to the physician who will further follow up the case with appropriate treatment and human immunoglobulin or vaccination against the particular virus and tetanus. Next is, as the sessions in the first and second sessions we saw, there's appropriate personal protective equipment should be there, like gloves, eyewear, aprons should be worn. Next is safe disposal of needles, sharps, broken glass pieces into appropriate puncture-proof containers should be there. Okay, filled with a suitable disinfectant such as 1% sodium hypochlorite solution. Okay, in the next session we'll learn about the waste management in detail. Next is do not overfill the sharp containers. Timely changing of the containers is very, very important. Follow the universal precautions meticulously and never recap the needles. Once again, I repeat, never recap the needle, but if it is unavoidable, then place the syringe horizontally and the cap as well, and carefully insert it with one hand. Next is, do not hand over the syringes or needles directly. Place them in a container. Okay, directly you cannot hand over, just place them in the container and tell the other person to take it from that container. Report all the needle stick injuries and the sharps. If any incident of this happens, you need to report it. Take vaccine for hepatitis B and if needed for tetanus as well. And lastly, we are at the end of the slide. Here, evaluation and follow-up. Okay, here what to do if there is a needle stick injury case in your hospital, do not panic. Just you have to inform the incident to the infection control nurse. She will guide you. She will prepare a report regarding this incident. She will guide you. Then you have to visit a physician. He will take a thorough history. After that, he will advise you to get yourself tested for the HIV, HBs, AG and hepatitis C viruses. And once you get the report, if the report is negative, you don't need to worry about anything. But if the report is positive, then you have to follow the protocol for the treatment and do the regular follow-up for the same. Okay? Till here, everyone has understood? Yes? Thank you.
Ma'am, kindly wait for a moment. Let us give a big round of applause to ma'am. Thank you, ma'am, for the excellent informative session. Now I request Ms. Sana Afreen, ma'am, a faculty of Riddhi Vinayak College of Nursing, to come on the stage and offer a plant as a token of appreciation to Flavia, ma'am. Give a big round of applause, everyone. Thank you, ma'am. Safety doesn't happen by accident. It is a result of awareness and the right practice. Your guidance will surely help us promote safer healthcare practice. Thank you, ma'am. Now is the time for our session 4 on biomedical waste management. Effective waste management is a key component of infection prevention and quality patient care. For this, I invite Ms. Varsha Kale ma'am, Associate Professor at Riddhi Vinayak College of Nursing. Madam has completed her MSc in Community Health Nursing from Bombay Hospital College of Nursing and has 11 years of combined teaching and clinical experience. Her expertise in community and public health nursing will surely guide us in understanding the importance of safe biomedical and waste management practices. I kindly request ma'am to please come forward and share your valuable insight. Please give a round of applause to ma'am.
Okay. Good morning, everyone. Good morning, dignitaries. So, my topic is today's fourth session. My topic is biomedical waste management. So, what is biomedical waste? Biomedical waste means any waste which is generated during the diagnosis, treatment, immunization of human beings or animals in medical research activity related to biological process. I have collected some incidences and prevalences regarding to biomedical waste. Current data shows that biomedical waste remains a critical threat to a global public health and environmental integrity, with the World Health Organization (WHO) estimating that 5.2 million people die annually from illnesses related to unmanaged medical waste, while 85% of healthcare waste is generally non-hazardous. The remaining 15% is hazardous and can be infectious, toxic or radioactive. Bloodborne pathogens, improper disposed of sharps, needles and syringes are primarily drivers of infection. WHO estimates that 16 billion injections are administered globally each year, and unsafe practices contribute significantly to hepatitis B, hepatitis C and HIV. In hepatitis B, responsible for 1.7 million to 21 million new infections annually, and in hepatitis C, responsible for 3,15,000 to 2 million new infections annually, and in HIV, responsible for 33,800 to 2,60,000 new infections annually. So we can understand how biomedical waste is important to reduce all the statistical data of the infections. Now we'll see the types of medical waste. There are some types that medical waste which is classified in infectious waste, sharp waste, pharmaceutical waste, radioactive waste and non-hazardous waste. First we'll see infectious waste. These are material contaminated by water and body fluid, cultures and stocks of infections, organisms and patient waste from isolation wards. Second is pathological waste. These includes tissue material of human organs, fluids and animal carcass. Then the sharps waste. These includes used needles, syringes, responsible scalpels and blades, which is sharps. Then the chemical waste, the chemical which are used in the wards or in the medical institutions, that are materials like heavy metals in devices, solvents in laboratory, reagents and detergents. Then pharmaceutical waste, waste material that include unused, contaminated or expired drugs and any expired vaccines, which are responsible for biomedical waste. And genotoxic waste, hazardous, mutagenic, carcinogenic and cytotoxic drugs in cancer treatment and metabolites. Then radioactive waste are products including radioactive, diagnostic and therapeutic materials. Then non-hazardous waste, the material that are not biological, chemical or radioactive hazardous can includes in non-hazardous waste. Now we'll see major sources of healthcare waste. In the healthcare waste, sources are hospital, nursing homes and healthcare, mortuary centers, blood bank centers, laboratory centers, and some another sources of biomedical waste are veterinary hospitals, clinics and general practitioners, dispensaries, blood banks, pain, palliative and rehabilitative centers, animal houses and research institutes. So these are the sources where the biomedical waste can generate. Now the effects of biomedical waste. So first is chemical injuries. Exposure to any chemical toxic like mercury, xylene and formalin can result in chemical injuries among health personnel and patient in contact. Then second is microorganisms. Whatever the microorganisms we can come into contact and with the patients due to the exposure to surfaces that are soiled with infected body fluids. Next is contamination of water and exposure to toxic waste. Improper disposal and lack of properly designed landfills can lead to contamination of water and exposure to toxic waste. Then toxic air pollution. Inadequate incineration leads to air pollution. The failure to use proper filters adds to the release of such pollutants into the incineration of chlorine containing waste produces dioxins that are or that can be carcinogens. Then risk and exposure to sharp, lack of segregation, which is the part of biomedical waste management. So lack of segregation of the biomedical waste can lead to risk of exposure to sharp among the workers of waste disposal and treatment. Spread of infectious diseases. Open waste dumping results in piling up of the waste which attracts insects. These dumps during the rains become breeding areas for the insects and as sources for vectors which spreads the infectious diseases. Pouring and next effect is pouring of the antibiotics into the drain results in the killing of required microbes and altering the environment that helps in the breakdown of biological matter in septic tanks. Now the most important part of this session is biomedical. We have seen biomedical waste and the types of biomedical waste. Now the best and most important part is steps of waste management. Whatever the biomedical waste is there, how to manage that biomedical waste. First is segregation. These are the steps. You all know that. You all are known of all the steps. So first is segregation, second is collection and storage, third is transportation, and last one is treatment and disposal. Okay, first segregation. In segregation, what we do to separate infectious waste from non-infectious waste? We have to segregate infectious and non-infectious waste, right? Facilitate final treatment, reduce cost of treatment, reduce impact of the waste on the community, and the segregation again further classified into 10 categories as per the schedule 1 in biomedical waste handling rules in 19, which is given in 1998. So these are the categories. Category 1 type of waste is human anatomical waste. Category 2 animal waste. Category 3 microbiology and biotechnological waste. Category 4 waste sharps. Category number 5 discarded medicine and cytotoxic drugs. Category number 6 soiled waste. Category number 7 solid waste. Category number 8 liquid waste. Category number 9 it is incineration ash, and last one is category number 10, it is chemical waste. So now these are the categories, but according to the schedule 2 there is color coding. We also all of known about the color coding of biomedical waste, how to segregate according to the colors, right? So there are some colors like yellow, red, blue, black and white. So in yellow bean, infectious waste, bandages, cotton, body parts and placenta. In red, infected dressings, POP casts. In blue, gloves, syringes and plastic waste can be there. And in red, cytotoxic drug and chemical waste can be there. And in white, we can dispose or we can segregate all the needles and sharps or the cut glasses. So what are the methods of transportation and storage of biomedical waste? Temporarily, the waste is stored in the central storage area of the hospital, and from there it can be transferred to the final disposal site in bulk. It can be transferred once or twice during the day depending on the quantity of the waste. Ensure that the containers and plastic bags are properly sealed and labeled with biohazard symbol. You all know the biohazard symbol? Yes? Okay. And the bag should not be filled, overflow hona nahi chahiye. So next is one bag at a time should be lifted. Minimize manual handling of the bags to reduce needle prick injury and infections. Sharps can be stored in a sharp container which can prevent sharps from harming the waste bag. Biomedical waste should be kept only in specific storage areas. Clean the containers as well as the lid with disinfectant properly after the removal of the bag. Waste bags and containers should be removed daily from the wards. The waste bags should be transferred in covered wheeled containers or large bins covered with trolleys. Biomedical waste should not be stored for more than 48 hours. Then the treatment needles 1% freshly prepared hypochlorite solution, which is just now covered in the previous session. Microbiology laboratory waste, autoclaving, pathology and biochemistry blood specimens, 5% freshly prepared hypochlorite solution, overnight washed, bulb reused. Whenever infectious material poured in sink or bathroom, it should be followed by pouring of 1% hypochlorite solutions in sink or bathrooms. So what is the method of biomedical waste disposal? So we'll take it in short, that is deep burial, autoclave and microwaving, shredding, land disposal and incinerations. So according to the categories, in deep burial category 1 and 2 only in cities with fewer than 0.5 million, autoclave and microwaving category 3, 4 and 7, the categories which have seen in segregations in schedule 1. Okay. In shredding, the plastic and sharps should be shredded only after chemical treatment, microwaving and autoclaving. Land disposal, secured landfill disposal and open dumps. Incineration, it is an oxidation process that reduces organic and combustible waste to inorganic incombustible matter. Categories 1, 2, 3 and 5 can be incinerated. So there are the colors yellow, red and black, and type of containers for yellow plastic bag, waste category 1 to 5. This is in short in the table which I have discussed in previous slide. Then in yellow plastic bag category 1, 2 and 5, treatment options can be incineration and deep burial. In red plastic bag category 3, 6 and 7, autoclaving, microwaving and chemical treatment. In black plastic bag category 5, 9, 10 and non-infectious waste disposal in secured landfills. So till here we have seen what is biomedical waste, what are the types of biomedical waste, what are the steps of biomedical waste. Now who all the persons responsible for biomedical waste management? The all persons who generate, collect, receive, store, transport, treat, dispose or handle biomedical waste in any form in the medical situations or healthcare situations. So what are the rules for biomedical waste management? Biomedical waste rules were formed under Environment Protection Act 1986 by the Ministry of Environment and Forest, Government of India. Biomedical waste management and handling rules in 1998 implemented on 28th July 1998. The guidelines have been prepared to enable each hospital to implement the said rules. Further amendments of the biomedical waste rules 1998 were done by Government of India in the year 2000 and 2003. So now, along with biomedical waste, it is very important to take precautions that are universal safety precautions, which is very important. The maintenance of high standard of protection against direct contact with blood or any kind of body fluid will protect the healthcare workers from exposure to any kind of infectious agent. Then exposure may be percutaneous, conjunctival or via mucous membrane. Universal safety precautions is the most effective method of preventing HIV in healthcare settings. All patients' blood and body fluids are to be considered potentially infectious. And these USP, that is universal safety precautions, includes barrier precautions, aseptic precautions, management of parenteral and mucous membrane exposure to infectious agents, effective use of sterilization and disinfections, effective waste disposal, and most important is immunization whenever and where it is necessary. For an example, hepatitis B. So barrier precautions are hand washing before and after contact with each patient, gloves to be worn in case of direct contact with blood or body fluid, eyeglasses if splash is likely to occur, mask covering both mouth and nose to prevent splashing and inhalation of infective aerosols, gowns and waterproof aprons to be worn for all procedures. So these are the universal precautions. Universal precautions that wash, gloves, gown, mask, sharps, vest and linen. So precautions for handling medical waste. First is how to take precautions for handling medical waste. First is never transfer sharps directly from person to person. Second is never recap the needles. Third is never overload bins used for storing biomedical waste. Next is do not inhale chemicals directly. Use always mask. Keep away sharps medicines from children. And last is never transfer sharp directly. Okay. Why do waste management practices fail? We all are doing waste management in very particular manner, but why it is again and again failing? First is lack of awareness of health hazards related to healthcare waste, lack of training on proper waste disposal practices, absence of available constructed waste disposal system, a low priority level even after knowing the harmful effects of improper waste disposal, a lack of funds and resources towards constructing waste disposal system, occupational risk to healthcare waste exist but have not been efficiently addressed. This is in short waste management in healthcare. Thank you. So I would like to conclude my topic with the help of one video. Here only.
अरे ओ नीले पीले डब्बो, जरा बताओ तो हॉस्पिटल में कितने तरह का कचरा होता है? हाँ?
हॉस्पिटल में 4 तरह का कचरा होता है सरदार।
सुन लिया ना जितेंद्र बाबू?
हाँ, ये तो मुझे पता है, पर प्रॉब्लम ये है कि किस बिन में क्या डिस्पोज करना है, ये कैसे याद रहे?
जिम्मेदार डब्बों, समस्या क्या है सुन लिया ना तुम लोगों ने?
हाँ सरदार।
हाँ सरदार नहीं, तरीका अपनाओ असरदार। अरे तो अब शुरू हो जाओ।
मैं हूँ वाइट यानी कि उजला, निडल सुई शार्प, कुछ भी हो नुकीला, सब ऐसा वाइट का ही है झमेला।
बहुत अच्छे।
आईवी नली, प्लास्टिक, थैली थैला, सब लाल में ही है धकेला। ओह क्या भूले, क्या गलती हुई? सिरिंज बिना सुई।
यस।
क्या बोले भाई? मैं हूँ पीला, प से पीला, प से पट्टी। नहीं, अपुन ऐसे बोलेगा, टिश्यू कटेला फटेला, खून से सनेला, पुरानी दवाई का हो झमेला, या केमिकल का लोचा, इसका उपाय सोचा, तभी तो पीला लगाया। समझे मेरे भाया?
समझे?
हाँ हाँ।
अब आई मेरी बारी। अच्छे से कर लो जांच, नीले में हो शीशा और कांच।
समझे? शाबाश। हाँ? अब देर तेरा क्या होगा रे कालिया? तुम्हारे लिए अलग से कार्ड बनवाऊं क्या?
नहीं 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 सरदार, दरअसल हम इस बिरादरी में नहीं हो ना, पर हम काले हैं दिल वाले हैं, म्यूनिसिपैलिटी का जनरल वेस्ट ले जाने वाले हैं सरदार।
अब समझे आप, या अभी भी मन में है कोई डाउट?
नहीं नहीं, अब नहीं है कोई डाउट, कंफ्यूजन सारी हो गई है आउट।
टोटो खुश हुआ।
Okay, I hope this is very useful for you all. The session which includes biomedical waste management, and in biomedical waste management the color coding and the segregation part, which is very important. I'm not saying other parts are not important, but the most important part is how to segregate the biomedical waste and how to dispose it according to the color coding, because we all are working in the healthcare settings and all the color codings are there, and don't be confused with the color codings. Because of that only the session is there to revise it, how to waste and where to waste. Okay, thank you so much.
I kindly request Varsha ma'am to stay on the stage and give a big round of applause to ma'am and thank you ma'am for the excellent session. I request Nupur Shivtare ma'am, faculty of Riddhi Vinayak College of Nursing, on stage to offer a plant as a token of appreciation to Varsha Kale ma'am. We welcome you ma'am. Let us give a big round of applause. Thank you Nupur ma'am and Varsha ma'am. Now we move to the final session of the day. The topic is counseling of infected patient. Empathy and communication are the heart of effective patient care. Counseling plays a vital role in supporting infected patient and helping them to cope up emotionally and psychologically. To guide us on this topic, I invite Ms. Pragati Murkar ma'am, Associate Professor at Riddhi Vinayak College of Nursing. Madam has completed her specialization in mental health nursing from Symbiosis International University, Pune, and has 11 years of teaching and clinical experience. Madam has completed certification course in forensic nursing, certificate course in DOAG, and worked as conference coordinator. Her expertise in mental health will certainly help us to understand the importance of counseling and psychological support for infected patients. I kindly request Ms. Pragati Murkar ma'am to deliver the session. We welcome you ma'am. Please give a big round of applause for ma'am.
Thank you, Vishakha. So, at last, we reached our today's last session, that is counseling of infected patients. So, here we will start with the counseling of infection patients. Talking about the introduction, as a nurses or as a healthcare professionals, we know that it is a very big task when you are working with the infected patient, right? So before giving any information to a patient, how we can give this information in a counseling, that we are going to see. So while counseling, we have to more focuses on the information, how we can information give to the patients, how we are giving emotional support to the patient, guidance to the patient, how we can stop the transmission of the infection towards the each other, and how we can give the right information about the treatment to the patients. My main purpose of this counseling of infectious patient is the how we can stop their transmission to each other and how we can prevent this infection to the others. Here I given some worldwide infectious disease statistics. Here you can see 23-24 in a year that there are tuberculosis was globally 10.8 million for 23 in the 2023. There are 1.25 million cases are death which annually recorded. HIV and AIDS 39 million, and there is a 30 cases that is a deaths are annually recorded. Talking about the malaria disease, it is a globally we found here 249 million cases and 6,800 cases were death. Talking about the hepatitis B and C, there are 54 million cases we found out globally, and there are 1.1 million cases were death. Talking about the COVID-19, we know that this is the till 2019 to 22, we have faced this problem, that is more than 7 million deaths are recorded globally. Here I mentioned few disease conditions which we required the counseling, that is HIV and AIDS, tuberculosis, hepatitis B and C, sexually transmitted infection, malaria, dengue and fever, rabies exposure, and the COVID-19. Now here I want to inform this that what is a counseling actually. Counseling is nothing but what it is giving the right information to the patient before the testing and after the test. That is your counseling main purpose. So here there are two types of counseling. The first one is a pre-test counseling and the second is your post-test counseling. As I just discussed, that is a pre-test मतलब क्या होता है, जहाँ पे एक टेस्ट को हम लोग चालू करने से पहले what information we have to give to your patient and after they are done with your test, उसका result positive हो या negative हो, उसका क्या होने वाला है, that is your post-test counseling. We start with the first one, that is a pre-test counseling. Yes, that is the first one is a provide the information. कि pre-test counseling में आपको अगर कोई disease का, for example अगर HIV का patient है या फिर कोई patient आपके पास TB के लिए test करने के लिए आया है, तो उसके साथ हमें क्या information देना है. The first one is to give the provide the information about the disease condition. Second is obtain the consent of the patient कि yes so and so test you are going to do, so we need your consent. Address the patient concern. Patient को यहाँ पे बहुत सारे questions दिमाग में हो सकते हैं. So yes, we have to address and we have to answer the each and every questions answer. Discuss the confidentiality. Patient को हमें आपको assure करना है कि yes, whatever the information you are going to give us or after the result or after the post test, whatever the result is going to come, it should be maintained in the privacy. Explain the procedure. ऐसा नहीं कि patient आया है कुछ भी कर लो चल जाएगा, नहीं. We have to each and every aspect, we have to procedure का each and every step we have to inform to your patient. Discuss the possible result. We have to inform your patient कि अगर positive result आया तो क्या होगा, result अगर negative आता है तो क्या होता है. Because most of the times patients क्या कहते हैं, positive result आ गया ना, ओके मैं अभी कैसे जाऊंगा डॉक्टर के पास, मैं काउंसलिंग कैसे करूंगा, मेरे साथ क्या होगा, तो they will not go for the post test only, right? तो yes, pre-test only we have to inform about the both the situation, post test also and the positive also and negative too. Mention the follow-up care of the patient and also reduce the anxiety. Ultimately what we are going to do, we have to reduce the anxiety of your patient. The second one is what, that is a post-test counseling. Of course after the investigation or after the blood test of the patient. Now the result can be positive, the result can be a negative. So we have to inform the proper result to the patient. Offer the emotional support. अगर patient का result positive है, तो of course the patient needs the emotional support over here. So we have to be a sympathize with the patient. Discuss the implications. Patient को यहाँ पे हमको inform करना है. अगर TB patient से तो हम लोग को डॉट ट्रीटमेंट के बारे में बताना है, कैसे ही करना है, उसका अगर कॉस्ट कितना है, कितने ड्यूरेशन के लिए करना है, दैट होल इंफॉर्मेशन वी हैव टू गिव इन दिस पोस्ट टेस्ट. वी हैव टू प्लान अ सर्टन वे दैट सो दैट द फॉलोअप के लिए जो पेशेंट्स आएगा तो उसमें उसको कोई भी प्रॉब्लम ना हो सके. Provide the proper information and the right information to the patient. There are some helpful tips I given over here that stay calm when we are giving the any information to the patient. Don't be a non-judgmental. Why? कभी हम लोग सो पेशेंट को चलेगा कि मुझे भी HIV AIDS हो गया है, पॉजिटिव हूँ, तो मेरे साथ कोई भी कैसे भी बहराव करता, तो इसको यहाँ पे हम लोग क्या करें, वी शुड बी आर नॉन जजमेंटल टू द पर्सन. Be empathetic and respectful towards your patient and give a clear and accurate information to the patient. So hope everyone is understood about the pre-test and the post-test. Now here's our mention of the key counseling areas for an infected patient, such as establish rapport, assist your patient knowledge, provide the accurate information, psychological support, family counseling, ethical principles, promote treatment adherence, prevention education, social support, and the follow-up. We'll see one by one these key factors. द फर्स्ट वन इज एस्टैब्लिश अ रैपोर्ट. अल्टीमेटली काउंसलिंग हम लोग क्यों करें? टू मेंटेन दिया एस्टैब्लिश अ गुड रैपोर्ट विद योर पेशेंट, टू बिल्ड योर ट्रस्ट विद योर पेशेंट. असिस्ट द पेशेंट नॉलेज. ऐसा नहीं कि हम लोग को ये तय करके चल रहा है कि पेशेंट को सब पता है या फिर पेशेंट को कुछ भी नहीं पता है. वेल टॉकिंग विद योर पेशेंट यू शुड नो कि पेशेंट को क्या पता है, उसके कुछ अगर उसको जो इन्फॉर्मेशन पता है तो वो गलत है या सही है. एनी काइंड्स ऑफ अ मिथ्स इफ इट इज देयर देन वी हैव टू करेक्ट इट. वी हैव टू सी द पेशेंट को कोई फैमिली सपोर्ट है अवेलेबल या नहीं है, पेशेंट का इमोशनल स्टेटस कैसा है आफ्टर द रिजल्ट. ओके, provide accurate information to your patient. In that we have to see the how we are going to transmit to the others. Symptoms हमको check करना है and their treatment options we have to inform your patients. Also we have to talk about the psychological support with your patient so that it is ultimately going to reduce your patient anxiety. Family counseling also important because TB cases, HIV cases where the patient are going to transfer their disease to the or infection to the others. So yes, it is required the family counseling so that others people will not get. Ethical principle. As a medical professional, we have to follow this. Confidentiality of your patient, informed consent should be taken, respect for autonomy, and yes, there should be a non-judgmental and the non-discrimination with the patient. Our next key factor is promote your treatment adherence. ऐसा नहीं कि पेशेंट को सिर्फ मेडिसिन देना है, 3 बार लेना है और 6 महीने के बाद आना है. नो, वी हैव टू इन्फॉर्म दियर ईच एंड एवरी मेडिसिन दैट ये उसके साइड इफेक्ट्स क्या हो गए, उसका इम्प्लीकेशन क्या है, एक्शंस क्या है, कैसे लेना है, कॉस्ट क्या होगा, कितने ड्यूरेशन के लिए लेना है, एंड फॉलो अप विजिट. दिस ऑल द मेजर्स वी हैव टू टेक इन दियर ट्रीटमेंट अध्यरेंस. देन प्रिवेंशन एजुकेशन. इट इज़ नॉट लाइक दैट किसी पेशेंट को इन्फॉर्मेशन की ज़रूरत है, पेशेंट के फैमिली को भी इन्फॉर्मेशन की ज़रूरत रहती है. सो वी हैव टू गिव अ प्रॉपर एजुकेशन अबाउट दिया disease condition. We have to inform the how we can prevent this disease condition to the others, such as by doing explain the high hygiene practice, discuss the vaccination, promote the safe practices, and explain the disease transmission. We have to do a follow up also, right? तो yes, तो पेशेंट को यहाँ पर बोलना है कि अगर पॉजिटिव भी रिजल्ट आता है, you should come for the follow up so that जहाँ पे इसका जो प्रोग्रेस है वो हम लोग क्या कर सकते हैं, उसको गुड प्रोग्नोसिस में बदल सकते हैं. While doing the counseling, we also require the communication skill. We have to be an active listener towards your patient. Patient को यहाँ पे हम लोग ज़्यादा से ज़्यादा सुन के लेना है, उनके problems क्या है वो देखना है, and we have to answer the each and every question of your patient. We have to very clear communication. ऐसा नहीं है कि patient हिंदी में या मराठी में बात कर रहा और आप अपने medical language में उसके साथ बात कर रहे हो. Of course patient को यहाँ पे कुछ भी नहीं समझेगा, इसलिए every time whenever you are with the patient, talk with their understanding language. You should be a non-judgmental approach towards your patient. Okay, now we have seen the key factors. Now we are going to move towards your benefits of a counseling. Of course, ये counseling करने के बाद patient को कुछ ना कुछ तो फायदा होगा. एक तो pre-test में हो सकता है या फिर post-test में हो सकता है. तो ये द फर्स्ट वर्ड दैट इज इम्प्रूव अध्यरेंस. पेशेंट को यहाँ पे उसके जो ट्रीटमेंट है, जो मेडिसिन है, उस चीज़ के बारे में उसको इन्फॉर्मेशन मिलेगा, डोज कैसे लेना है, साइड इफेक्ट्स क्या है या फिर उसका एक्शन कैसा है. दैट देन इम्प्रूव अध्यरेंस, एजुकेशन एंड प्रिवेंशन, इम्प्रूव दिया रिड्यूस दिया सिग्मा ऑफ दिया डिजीज कंडीशन. Now we'll move with the barriers. We saw the key factors, we saw the benefits of the infectious disease counseling. Now we are going to move to the barriers to a counseling. Of course हम लोग बोलते हैं की आपण जीवनामध्ये पण जेव्हा काम करतो आपल्याला अडथळे खूप येतात. आता अडथळा आला तर आपण काय करतो, ते सोडून देतो का? नाही. आपण जेव्हा वार्डमध्ये पण काम करतो आपल्याला खूप सारे प्रॉब्लेम्स येतात, पण आपण ते फेस करतो आणि आपण एक नेक्स्ट स्टेजवरती पोहोचतो. इन अ सेम वे while dealing with the such a patients or we are counseling with the patients, we are going to get these barriers. So these are the few barriers. The first one is the stigma and discrimination. पेशेंट को हमेशा यहाँ पे डर लगते रहेगा कि अगर मेरा रिजल्ट पॉजिटिव आ गया तो लोग मुझसे क्या कहेंगे यहाँ पे, या फिर लोग मुझसे बात करना बंद कर देंगे. ये हमेशा उसके मन में क्या रहेगा, स्टिग्मा होगा. लैक ऑफ अवेयरनेस और नॉलेज. पेशेंट को यहाँ पे पता ही नहीं कि अगर मेरा टीबी पॉजिटिव रिपोर्ट आ गया तो मुझे करना क्या है. तो ही इज़ नॉट हैविंग एनी लैंग्वेज. अगर उसका HIV का रिजल्ट पॉजिटिव आ गया, उसको पता नहीं है मुझे करना क्या है, तो दैट विल बी अनदर लैक ऑफ अवेयरनेस. फियर ऑफ अ डायग्नोसिस और अ ट्रीटमेंट. अभी मुझे न्यूरोस्टिक इंजरी जैसे कि बताया गया था सेशन में, न्यूरोस्टिक इंजरी हो गया तो क्या करोगे, राइट? यहाँ पे नर्सेस को भी यहाँ पे एक डर होता है कि मुझे न्यूरोस्टिक इंजरी हो गया तो मैं करूँगी क्या, अगर मेरा रिपोर्ट पॉजिटिव आ गया तो मुझे सब लोग क्या बोलेंगे. तो येस, देयर इज अ फियर ऑफ अ डायग्नोसिस ऑन द ट्रीटमेंट. कल्चर एंड सोशल बिलीव्स, लोगों को ऐसे लगेगा कि अगर मेरा रिपोर्ट पॉजिटिव आ गया लोग मुझे समाज से निकाल देंगे, कोई भी मुझे मंदिर में नहीं लेगा, राइट? तो दिस आर द वन ऑफ द बैरियर, तो पेशेंट डॉक्टर के पास जाएगा ही नहीं यहाँ पे. लैंग्वेज बैरियर, एज आई सेड, पेशेंट को अगर कम्युनिकेशन प्रॉब्लम है, पेशेंट हिंदी में बात कर रहा है, आप इंग्लिश में बात कर रहे हो, देयर कैन बी अ लैंग्वेज बैरियर टू योर काउंसलिंग. लिमिटेड हेल्थ केयर एक्सेस, नाउ वी आर इन staying in the urban area, हम लोग को सब फैसिलिटीज अवेलेबल है. इवन मैम सेज दैट नर्सिंग होम्स आर अवेलेबल इन ईच एंड एवरी लेन, राइट? बट जहाँ पे अर्बन एरिया के साथ में जब हम रूरल एरिया देखते हैं तो रूरल में ऐसा नहीं है. समटाइम्स द पीपल हैव टू ट्रैवल एटलीस्ट 4 to 5 hours टू गेट दैट हेल्थ केयर फैसिलिटी. तो येस, देयर कैन बी लिमिटेड हेल्थ केयर एक्सेस टू द पेशेंट टू रीच द हॉस्पिटल्स. And the last one is the lack of a privacy or a confidentiality of a concern. पेशेंट को हमेशा यहाँ पे डर लगते रहेगा कि मेरा इन्फॉर्मेशन अगर लीक हो गया तो, अगर सबको पता चल गया कि मैं HIV पॉजिटिव हो तो उस डर के वजह से वो क्या करेगा, टेस्ट के लिए वहाँ पे नहीं जाएगा. होप एवरीवन इज अंडरस्टूड. ओके, नाउ विल मूव विथ द स्ट्रॅटजीज. आपण काय काय बघितलं, बेनिफिट्स बघितले. बेनिफिट्सच्या आपण काय बघितलं, त्यांचे अडथळे पण बघितले. नाउ दिस अडथळा और वी कैन से ब्लॉकेजेस, वो रोकने के लिए हम लोग क्या करेंगे, वी हैव टू डू समथिंग एक्शन, वी हैव टू डू सम स्ट्रैटेजीज. तो वो क्या क्या है वो देखते हैं एक बार. वी हैव टू प्रोवाइड अ क्लियर एंड सिंपल हेल्थ एजुकेशन. इसीलिए बोला गया है प्री टेस्ट में जब आपके पास पेशेंट आता है तभी आपको काउंसलिंग इतनी अच्छी से कर रहे हैं कि पेशेंट को वो उस चीज़ के लिए डर नहीं लगना चाहिए. वी हैव टू गिव अ क्लियर इन्फॉर्मेशन टू योर पेशेंट्स. बिल्ड अ ट्रस्ट एंड रैपोर्ट, उसी की वजह से क्या होगा, तुम्हारे पेशेंट का तुम्हारे लिए एक ट्रस्ट गेन होगा वहाँ पे. यूज अ कल्चरली सेंसिटिव कम्युनिकेशन, हमें यहाँ पे देखना है कि पेशेंट के कल्चर्स को, उसके बिलीव्स को कोई भी प्रॉब्लम्स ना हो सके. वी हैव टू ट्रेन योर हेल्थ एजुकेटर वर्कर्स इन अ सच अ वे सो दैट दे कैन ईजिली कम्युनिकेट विद देयर पेशेंट्स. ऑल्सो वी हैव टू maintain their privacy and a confidentiality with their patient. Here I given some examples. If the patient is coming with the tuberculosis, how we can do a counseling. So first one, as I said, provide the accurate or the right information to your patient. Ensure the treatment about their patient. Give a proper normal or a proper education about their control measures. Then address the stigma and misconception if the patient is having. Contact tracing and a testing. Give a nutritional and a psychological support to your patient. And of course, at the last, we have to do the follow-up care with the patient. Talking about the hepatitis B, this is my second example. Here also we can provide same thing. That is the first one. Explain the disease condition. Transmission, we have to inform the patient about the transmission कि कैसे हो सकता है दूसरों को भी. How we can prevent this disease condition by doing of the vaccination. About the treatment, we have to inform. Lifestyle advices, and the last one is the emotional support towards patient. Third example, that is a STD or a sexual transmitted infection. Provide the information again about your disease condition. Discuss the safe sex practices about your patient, towards your patient. Address the stigma and the myths. And they emphasize the treatment, again information about the medicine. Discuss the risk reduction towards your patient and encourage your partner communication. Okay, so here now we start with the community role of a nurse. Yes, as a nurses we also working in the community area too. तो ऐसा नहीं है कि सिर्फ जब पेशेंट हॉस्पिटल में आएगा तभी तुम्हारा काम है. नो, व्हेन वी आर वर्किंग इन द कम्युनिटी, इवन व्हेन वी आर स्टेइंग एट आवर होम, अपने आजू बाजू में अपने नेबर्स होते हैं, वो आपके पास आते हैं, तो उनको आप कैसे सजेशंस दे सकते हो. So here again the same one, we have to provide the health education as we discussed. अभी हम लोग देख रहे हैं कि यहाँ पे भी एक ट्रेनिंग प्रोग्राम ही चल रहा है. वी आर प्रोवाइड द एजुकेशन टू यू, राइट. अभी आप और घर पे जाओगे, घर पे जाके बताओगे कि हाँ मेरे साथ ये हुआ, हमने आज 5 सेशन सुने, 5 सेशन में ये टॉपिक था. अल्टीमेटली यू आर गोइंग टू गिव इन्फॉर्मेशन टू योर फैमिली मेम्बर्स. आप अपने फैमिली मेम्बर्स को दोगे, वो जाके और 2 लोगों को जाके बोलेंगे कि यस आज मेरी वाइफ ने ये काम किया, या फिर उन्होंने ये सेशन के ऊपर लेक्चर लिया है करके, राइट. दैट इज यूर प्रोवाइडिंग द हेल्थ एजुकेशन टूवर्ड्स द अदर्स. एनकरेजिंग द अर्ली डायग्नोसिस एंड द ट्रीटमेंट. जैसे कि हम लोग को एक पेशेंट तो फाइंड आउट हो गया है कि हाँ ये HIV पॉजिटिव है, वी हैव टू इन्फॉर्म द फैमिली मेम्बर्स टू दैट कि अगर आपको हुआ है तो देयर इज अ चांसेस ऑफ द गेटिंग दिस सेम इन्फेक्शन टू द योर फैमिली मेम्बर्स. Promoting the prevention and their practices to a patient also reduces the stigma and discrimination. We can provide their role play or a social drama or a psychodrama to the patients in their community so that we can provide the maximum health awareness to the patient. Also we have to support their treatment, as we know that the government डॉट्स थेरेपी के लिए फ्री ऑफ ट्रीटमेंट देता है, HIV के लिए फ्री ऑफ ट्रीटमेंट देता है. तो दैट काइंड ऑफ अ सोशल वर्कर को हम लोग बोल के हम लोग की इन्फॉर्मेशन पास कर सकते हैं. This is the last now, documentation of best practices. As a nurses we know that काम करो या ना करो, documentation होना बहुत ज़रूरी है. In a same way, counseling में भी it's very important. पेशेंट जब से इनसाइड तुम्हारे कैबिन में आ गया, वहाँ से लेके टिल द फॉलोअप तक आपको डॉक्यूमेंटेशन करना काम बहुत इंपॉर्टेंट है. सो यस, क्लियर एंड एक्यूरेट इन्फॉर्मेशन आपको वहाँ पे करना है. यूज अ टेम्पलेट सो दैट अब हम लोग फार्मेसी में भी जाते तो देखते हैं टेम्पलेट्स वहाँ पे रहते हैं. सो दैट इट विल गिव द शॉर्ट एंड स्वीट इन्फॉर्मेशन टू योर पेशेंट्स. बी अ कंप्लीट इन्फॉर्मेशन. वॉट एवर इन्फॉर्मेशन आर गोइंग टू राइट, इट शुड बी अ कंप्लीट. अपडेट द रिकॉर्ड्स प्रॉम्प्टली, मतलब टाइम टू टाइम आपको क्या करना है, वहाँ पे जो रिकॉर्ड्स है वो आपको फिल आउट करना है. Stay eligible to with your patient. Ensure the confidentiality maintain of the patient. Be a concise and relevant information. ऐसा नहीं कि आपण म्हणतो ना थापट पसारा लिहून ठेवलाय. No, you should not do such a thing. Whatever it is important, the time and the signature is must. Review and verify. जो भी आपने लिखा है एक बार वापस से रीड करो कि whatever you have written the information, it is the accurate or not. Here some I found out some research evidence that counseling for infectious patient, after doing their counseling, there are 4.24 to 7.05 cases were improved in their counseling interventions. Talking about the summary of evidence, we find out doing their counseling session improve their treatment of the adherence, reduces the treatment failure and the drug resistance. It also enhances the patient knowledge and their self-care, and it is improves the overall infectious disease control. So ultimately जो हमारा purpose है, जो हमारा objective है, वो क्या हो रहा है, fulfill हो रहा है because of our counseling. Okay, so before starting my conclusion, I want to show you one video over here.
क्या हुआ राधा? तो कुछ बुझी बुझी सी लग रही है. अरे आज तो करवा चौथ है और चंदू भी आ गया. तुझे तो बहुत खुश होना चाहिए.
सवेरे तो मैं बहुत खुश हो रही थी भाभी, पर अब एक बात खाए जा रही है मुझे.
क्या बात?
वो भाभी, कुछ महीने पहले इनका शहर के पास एक्सीडेंट हो गया था. ये तो नसीब अच्छा था कि आसपास के लोग इन्हें गाड़ी से निकालकर पास के एक अस्पताल में ले गए. वहीं इनको खून भी चढ़ा. फिर बाकी सारा इलाज इनके दफ्तर वालों ने करवाया. अब तो सब ठीक है, पर वो खून जो उस पहले छोटे अस्पताल में चढ़ा था, उसकी HIV जांच हुई थी या नहीं, ये इन्हें भी नहीं पता भाभी.
ऐसे वक्त में इन सब चीजों का ध्यान ही कहाँ रहता है. और चंदू को तो चोट लगी हुई थी जब खून चढ़ा था. भगवान करे जैसा हम लोग सोच रहे हैं वैसा कुछ भी ना हो. पर राधा, ऐसे में जांच करवाना ही सही होगा. हमें भी नर्स बहन जी ने यही सलाह दी थी.
आपको तो पता है कि पूरा गांव अम्मा जी को कितना मानता है. अगर इनकी जांच होगी तो सारे गांव को पता चल जाएगा. लोग पता नहीं कैसी कैसी बातें बनाएंगे. हम किस किस को समझाएंगे भाभी? और तीरथ भैया जैसे लोग तो हमें अपने सुख दुख में बुलाना भी नहीं चाहेंगे. और जाने कितनी महंगी होगी ये जांच वांच. और अगर जांच में कुछ निकल आया तो मैं क्या करूंगी भाभी?
बस राधा, देख, पहली बात, HIV की जांच ICTC केंद्र में मुफ्त में होती है. और दूसरी बात, चंदू की HIV की जांच के बारे में ICTC के सलाहकार या काउंसलर सिर्फ उसी को बताएंगे और किसी को भी नहीं. उन्हें इस बात की खास ट्रेनिंग दी जाती है. इसीलिए जांच और नतीजा इन दोनों के बारे में किसी और को पता चल ही नहीं सकता, समझी?
ननद भाभी के बीच जाकर बैठ जाती तो वो बात ही नहीं कर पाती। चंदू मेरा इकलौता बेटा है, उसी से ये सारा घर संसार है। पर मुझे राधा की बात सही लगती है। चंदू को जो खून चढ़ा था उसकी HIV जांच हुई थी या नहीं किसी को नहीं पता। अब उसे अपनी HIV की जांच तो करवानी ही चाहिए, अपने लिए, राधा के लिए, और कल को जो इनके बच्चे होंगे उनके लिए।
देख, तेरे मन में जो जो आया तूने वो सब कह दिया। अब तू मेरी बात सुन। जब मुझे पता चला था कि तेरे भैया HIV संक्रमित हो सकते हैं तो मेरे मन में भी ये सारी बातें आई थी कि लोग क्या कहेंगे, हम समाज को कैसे मुंह दिखाएंगे। पर राधा, जिंदगी में बिल्ली को देखकर कबूतर की तरह आंखें बंद करके तो नहीं बैठा जा सकता ना, उसका सामना करना पड़ता है। अब जब नर्स बहन जी ने कहा कि तुम दोनों को HIV की जांच करवानी ही चाहिए तो मैं भी बहुत घबराई थी कि अगर गांव में किसी को पता चल गया तो क्या होगा। फिर डॉक्टर साहब ने तेरे भैया को बताया कि
देखो बाबूलाल, घबराओ मत, मेरी बात मानो। HIV की जांच तुम्हारी और तुम्हारे परिवार के लिए बहुत जरूरी है। अगर तुम्हारी रिपोर्ट नेगेटिव आती है तो परेशानी की कोई बात ही नहीं।
और अगर नहीं आई तो साहब?
हम तुम्हारे साथ हैं ना, हम तुम्हें सिखाएंगे कैसे स्वस्थ जिंदगी को जिया जाएगा। ये सब तुम्हारी रिपोर्ट पर है। और बाबूलाल, घबराओ नहीं, तुम्हारी रिपोर्ट के बारे में हम तुम्हारे अलावा किसी को नहीं बताएंगे।
मगर साहब,
मेरी मानो बाबूलाल, जल्द से जल्द जांच कराने में ही समझदारी है, फिर भी फैसला तुम्हें ही लेना है।
ये तो बहुत अच्छी बात है भाभी कि जांच के बारे में मरीज के अलावा और किसी को भी बताया नहीं जाता। पर भाभी, हम अपने आप से तो नहीं छिपा सकते हैं ना।
तो कहना क्या चाहती है?
यही भाभी कि एक बार हो जाए तो पूरी तरह ठीक होने की उम्मीद भी तो नहीं है।
राधा, तू कहना चाहती है कि तेरे भैया को कोई उम्मीद नहीं है? वो अपनी जिंदगी नहीं जी रहे? तुझे क्या लगता है हमारे घर में चूल्हा जलना बंद हो गया है?
नहीं भाभी, मेरा वो मतलब नहीं था।
अगर नहीं था तो भी मतलब तो वही निकलता है ना राधा। पर मैं इसका बुरा नहीं मानूंगी क्योंकि तुझे सही बात का नहीं पता। देख, अगर किसी को यह पता चलता है कि उसे ब्लड प्रेशर की बीमारी है या शुगर की बीमारी है तो वो जिंदगी जीना तो नहीं छोड़ देता ना। और ऐसी बीमारियां भी दवा से खत्म तो नहीं होती, पर डॉक्टर भी यही कहते हैं कि ये सावधानियां रखनी है, वक्त पे दवा लेनी है, बेवजह चिंता नहीं करनी है, अच्छा सोचना, कसरत करना, पौष्टिक खाना खाना और अपना जीवन अच्छे से जीना चाहिए। ICTC सेंटर में भी HIV की जांच से पहले और बाद में ऐसी ही बातें समझाई जाती हैं।
बाबूलाल जी, ऐसे वक्त में थोड़ा मुश्किल होता है अपनी पत्नी के पास जाना और उसे ये बताना कि मैं HIV पॉजिटिव हूँ, पर ये बताना भी जरूरी है क्योंकि आपसे ये इन्फेक्शन उनको भी लग सकता है। अगर आपने अपनी पत्नी को वक्त पर बता दिया है तो वो भी अपनी समय पर जांच करवा सकती है।
मेरी तो जिंदगी खत्म हो गई अब साहब।
नहीं बाबूलाल, अब भी आप वैसी जिंदगी जी सकते हो जैसी आप जी रहे थे। थोड़ा अपना ध्यान रखिए, न्यूट्रिशियस खाना खाइए, कसरत कीजिए, उबला हुआ पानी पीजिए, हमेशा अच्छा सोचिए। क्या क्या ऐसा हो सकता है साहब? बिल्कुल हो सकता बाबूलाल। आप भी आम आदमी की तरह जिंदगी जी सकते हैं। बस जो मैंने सावधानियां बताई हैं उन पे अमल कीजिए।
भाभी, तुम्हारी भी HIV की जांच हुई थी ना? तुमने अपने आप करवाई या
किसी ने मजबूर किया? नहीं राधा, तुम्हारी सहमति के बिना जांच नहीं होती। मुझे खुद ही अपनी जांच करवानी थी। सच जाने बिना नहीं रहना था मुझे।
कितनी समझदारी की बातें बता रही है सलोनी, है ना? अब तुम मुझे बताओ कि अगर किसी को संदेह हो कि वो HIV संक्रमित है तो जांच करवाना क्यों जरूरी है? एक, जिससे इलाज जल्द से जल्द शुरू हो सके और व्यक्ति को सही सलाह दी जा सके। दो, जिससे ICTC के काउंसलर उसे बता सके कि HIV संक्रमित होने के बाद भी कोई भरपूर जिंदगी कैसे जी सकता है। तीन, जिससे व्यक्ति दूसरों को संक्रमित करने से बच सके।
सही जवाब है, अगर किसी को संदेह हो कि वो HIV संक्रमित है तो जांच करवाना जरूरी है, क्योंकि इलाज जल्द से जल्द शुरू हो सके और व्यक्ति को सही सलाह दी जा सके। ICTC के काउंसलर उसे बता सके कि HIV संक्रमित होने के बाद भी कोई भरपूर जिंदगी कैसे जी सकता है और व्यक्ति दूसरों को संक्रमित करने से बच सके।
Okay, it's too lengthy video, right? But I think hope everyone is clear about my showing of this video of what is my idea, right? हमने स्टार्टिंग से जो एंड तक जो भी हमने अभी सीखा था, जैसे कि हाउ द बिफोर प्री टेस्ट हम लोग को कैसे करना है, पोस्ट टेस्ट में पेशेंट को क्या करना है, वही वो भाभी ने उसकी क्या किया, ननन को ये सब वहाँ पे बताया है। राधा को देखा होगा आपने कि कितने सारे क्वेश्चंस थे, राइट? अगर HIV हो गया तो क्या होगा, अगर HIV नहीं भी हुआ या फिर पॉजिटिव हो गया तो मैं क्या करूँगी, कैसे लाइफ जीऊँगी, राइट? या फिर मेरा पति के साथ मेरे क्या हो सकता है, कैसे हम लोग का आगे जाके होगा। तो शी इज़ हैविंग लॉट्स ऑफ क्वेश्चन। आप जो सोचो कि ये काउंसलिंग के वजह से पेशेंट को राइट इन्फॉर्मेशन भी मिलेगा, पेशेंट को हेल्थ अवेयरनेस भी होगा और पेशेंट के साथ में ही हम लोग क्या करेंगे, हम लोग स्टॉप कर सकते हैं ट्रांसमिशन को एक दूसरे को देने से। सो होप एवरीवन इज क्लियर अबाउट माय टुडेज टॉपिक। Thank you so much. So here we conclude with your topic, that is a counseling is a vital and a component in the management of an infectious disease. It is a help your patient to understand their illness, treatment options and the preventive measures. It's enabling them to make a informed health decisions. Effective counseling, it reduces the fear, stigma and the misconception about their disease condition. So because of counseling, it is going to reduce your fear and stigma. It gives a promote your treatment adherence and it is going to give you encourage your healthy behavior. So yes, here I am finished with my topic. Thank you everyone for your patience listening. Anyone is having any doubt regarding their topic? Huh? I'm giving 100% assurity that you will get your credit points. Okay. No, definitely you will get. Okay, here I want to say special thanks to Anupama ma'am that she has given me a opportunity to give this session to you or to provide this session to you. Thank you so much, ma'am. Thank you, observer ma'am. Thank you.
Ma'am, I request you to kindly wait on the stage for a while. Thank you, ma'am. Just give a big round of applause to the ma'am. Thank you, ma'am, for the wonderful session and very innovative PPT. It was very interesting. I request Varsha Kale, ma'am, Associate Professor of Riddhi Vinayak College of Nursing, to offer a plant as a token of appreciation to ma'am. Let us give a big round of applause. Thank you, Varsha ma'am and Pragati ma'am. Hence, we have finished all the sessions for today. we will having a post test. Participants are kindly requested to complete the post test and feedback forms. The barcode is displayed on the screen. I request volunteers kindly help participant. You can open Google Scan. Participants are requested to scan this code also for your feedback. This is the another code for the feedback. I request all participants sorry. After finishing your post test, I request all participants kindly give your feedback. I request all participants after completing your post test kindly give feedback. Hope all have responded. Now I will request Dr. Aparna Sankhe ma'am, observer of today's program, to come on the stage and share some insights, thoughts for today's program. We welcome you, ma'am. Give a big round of applause.
कंटाळे बिचारा गेलं झालं संपलं म्हणजे मला वाटतं एक तर भूक तरी लागलाय नाही तर घरी जायची घाई झालेली आहे ओके व्हेरी गुड आफ्टरनून टू वन अँड ऑल ॲक्च्युली सो आय हार्टली कॉंग्रॅच्युलेशन्स टू रिद्धी विनायक हॉस्पिटल फॉर ऑर्गनायझिंग सच अ वंडरफुल highly informative CPD topic that is on a infection control. It is very important for nurses and we all know आपल्याला सगळ्यांना माहिती आहे की infection control, why we need to learn about infection control, because we as a healthcare professionals we are very much susceptible for occupational hazards like what? HIV, ज्यावर फक्त अँटी रेट्रोव्हायरल थेरपी आलेली आहे, नो वॅक्सिनेशन टिल, कंप्लीट क्युअर पण नाही आहे. सो वी हॅव टू प्रोटेक्ट आवरसेल्व्स फ्रॉम सच अ ड्रेडेड डिसीज ॲज वेल ॲज यू हॅव टू प्रोटेक्ट युअर पेशंट, युअर क्लायंट, युअर सिग्निफिकंट अदर्स, दोज हू आर कमिंग विथ द पेशंट्स. सो इन्फेक्शन कंट्रोल protocol is to understand all this protocol and to practice infection control is our duty. We have to prevent hepatitis B, that is Australia antigen positive. Yes, it's a bloodborne. Then we have to protect hepatitis C, so HIV and other cross infections. So as a healthcare professionals, if we follow the protocol, and simple protocol is hand hygiene, which is very important. A simple hand hygiene, hand washing, that is a medical hand washing and surgical hand washing, can prevent infection, can prevent a cross infection. Yes, during COVID-19 pandemic had taught us how much it is important to use the personal protective equipment, that is gloves, masks, and how much it is important. And then the stock which were provided by the government, it was still there in our storeroom. Expiry date पण झाली त्याची, इतके एवढे सारे mask. So we all should know the mask which we are using. The effective mask is which mask is very effective? N95. How much it costs? If you see the cost, it's very expensive. So all the hospital, of course, Riddhi Vinayak is a tertiary care hospital with all amenities. They will provide all this personal protective equipment, but I am sure that all the nursing officers which have come from a diverse background, from government, from municipal corporation, yes, and I don't think all this PP stock, gloves, all is been provided. Enough stock asto ka? So sometimes we should know the protocol so that we can protect ourselves and we can protect our patient. We can prevent cross infection. We can prevent nosocomial infection. Yes, when patient is coming to healthcare facilities, already he is a compromise. He has susceptible, he is a vulnerable. If he is coming for his own disease, you have to cure his disease and not to infect him. Because if you don't follow the infection control practices, protocols, that patient will get nosocomial infection, hospital-acquired infection. And because of your hospital-acquired infection, that patient stay is, again it is lengthy stay to the hospital. And in government it's okay, but if in private, that patient's it is a financial burden for that patient. So we as a nurses, we as a healthcare professional, we should sensitize towards all these aseptic precautions and infection prevention protocol is very important. So in the sense from the morning, Dr. Anupama Oak, the principal, Riddhi Vinayak College of Nursing, she was discussed about introduction of infection control and all the standards. She has explained very well about infection prevention, IPCs. And I think, and really it was very nice to that demonstration by the nursing students about IPC. It was really a very informative and very educative from the what demonstration, what role play were by the students. Then Dr. Usha Menon madam, mindset of nurses related to prevention of infection, which is very important, because if you mentally we are prepared, if we sensitize, then only we can bring into the practice, and that practice will definitely, that practice will maintain the prevention of infection control. Then the important topic on the needle stick injury by Flavia D'Souza. So needle stick injury, yes, needle stick injury is actually it's a curse, and many needle burner, and then after that Center of Disease Control, CDC has given many guidelines about the universal safety precautions and how to segregate the biomedical waste. So biomedical waste management is really very important, and the nurses, those who are working in the hurried manner, many times during their duties, the biggest occupational hazard is needle stick injury. But we should not be in a panic. If suppose we get a needle stick, we should consider each and every patient as a HIV, and we have to, that is a universal safety precautions. We should not wait for a patient's diagnosis, because we don't know whether that person is in window period, and we know the pathophysiology of HIV, like human immunodeficiency virus. That virus, when it has entered into the body, to develop and to convert into the seroconversion, that is AIDS, it takes time. So it depends on the viral load of that patient, and it depends on the immunity of that healthcare professionals. It is very important. So we should be very cautious enough to handle the needle when we are implementing, when we are providing comprehensive nursing care to the patient. That needle stick injury, of course, your hospital should have, you have, I think, post-exposure prophylaxis. So as soon as the needle stick injuries occur, that person should counsel first. And that person, immediately that person should go to the post-exposure prophylaxis department, because that PEP department will counsel, will definitely will counsel, and they will prepare her psychologically to accept the medicine. Antiretroviral therapy plays a very important role in preventing the multiplication of HIV viruses. The fusion, the multiplication, yes, that is NRTI and NNRTI, non-nucleoside reverse transcriptase. So whatever the enzyme which were carried by HIV virus, that is reverse transcriptase inhibitor, protease inhibitor, integrase inhibitor, all that medication has that capacity to inhibit the multiplication, to stop this cycle of HIV replications. So needle stick injury itself is its complication, but after the needle stick injury, the antiretroviral therapy in the form of post-exposure prophylaxis is very important. That should be consumed by the patient, by the nurses, those who have suffered with the needle stick injury within no time. Even in the night time, if you have a needle stick injury, you should go to the PEP department. Not like, चला आता नाईट ड्युटी आहे, उद्या सकाळी मी जाते, घरी मी डिस्कस करते आणि मग सकाळी मी औषध घेते. No more discussion. We should not give chance to the HIV virus to replicate in our own human, in the host. So we should have that importance about the role of antiretroviral therapy. That important. And really in infection control, if you say ki you have to prevent nosocomial infection, you have to prevent infection control. So needle stick injury is a very important topic. Then biomedical waste management. Yes, biomedical waste management, and we all are nurses. We know, we as a healthcare professionals, even class 4 workers, they are involved in segregation of biomedical waste, and we as a nurses should teach them and should demonstrate them how the waste should be segregated. It should be as per the guideline. You take the session in their own language, Marathi, Hindi, explain them, teach them, demonstrate them how this best biomedical waste is managed properly. That is very important, and all that universal safety precautions, all that blue bag, yellow bag, yes. And of course, all the hospital, as Riddhi Vinayak Hospital is a NABH accredited hospital and definitely has a very good infection control unit. And they are doing all this monitoring and supervision for infection control, and they are working very well for this. Then the last session is about the counseling of infected patient. So those who are infected, and when they come to know it's a nosocomial infection, it's a hospital acquired infections. So they may develop a negative attitude towards a hospital, towards the healthcare facility. Because of this hospital, we are suffering with this infection. And they may not know, but what is our, we should sensitize about that. We know. Sometimes we don't disclose patient that this is a hospital acquired infection. Many times our nowadays in healthcare facility, whatever consumer you are receiving, the patient, those who are accepting your services, the patient तुमच्याकडे येतात ना, they are coming with a Google, they are coming with a chat GPTs, they are much more knowledgeable than you. So you develop, you update your knowledge, and rightly Maharashtra Nursing Council insisting all nurses to attend continue professional development by updating their knowledge, developing a positive attitude towards a profession, and create a professionalism among themselves. So really thankful to Maharashtra Nursing Council for credit point you have come, but in this hall now since from the morning a very calm and very sincere audience. Yes, Anupama madam, they were so sincere patiently they are listening, and there were no chaotic situations. I am Dr. Aparna Sankhe. I had come from College of Nursing. I am a principal in College of Nursing, JJ Hospital. We have conducted more than 10 CPDs. But out of 10, 7 CPDs were uncontrollable. All the participants were completely chaotic. Either they were sleeping or completely noise pollution. So the speaker couldn't explain. But you were so nice. So please round of applause for participant. And really, actually thankful and really congratulating all the participants for getting 10 credit point from Maharashtra Nursing Council. Definitely they are doing that process, and that 10 credit point will be deposited in your account. And we don't have that much time for 150 points. Is it 150 points? Huh? सगळे झाले का तुमचे? So now Anupama madam has started CPD. Next 15 days again there will be CPDs. As it is a first CPD, little bit started. थोडा 10-15 minutes late झाला, पण तुमचं कंप्लीट झालं वेळेमध्ये. अँड आय एम शुअर की मला वाटते बरेच लोक ऑफ ड्युटी पण आलेत आणि बरेच लोक ऑन ड्युटी आलेले आहेत, बरोबर ना? का ऑल ऑन ड्युटी? हां, सो आपली सुट्टी घेऊन आपले नाईट ड्युटी करून बिचारे नाईट ड्युटी करून पण आलेले आहेत. तर आय एम शुअर की इतकं स्पीकर हॅव प्रेझेंटेड व्हेरी वेल, व्हेरी इन्फॉर्मेटिव्ह CPD वॉज देअर, and you all have benefited with the knowledge, not only just 10 credit point. I hope तुम्हाला knowledge पण मिळालं असेल. So thank you Anupama madam for these CPDs, and thank you all the participants. Thank you the anchor. She was also standing from the morning, and she has given up to date time to time update about this infection control. Thank you very much.
Thank you, ma'am, for your valuable feedback and kind words. Let us give a big round of applause for the ma'am. Now we come to the
हॅलो, तुम्हाला
तुम्हाला माझ्याकडनं सगळ्यांचे मला आभार मानायचे आहेत. तुम्ही सगळा आमचे जेवढे सेशन्स होते तुम्ही शांतपणे अटेंड केले आणि मेन थिंग आम्हाला लवकर सुरू करायचं होतं, पण आम्ही आमच्या चीफ गेस्टसाठी म्हणजे आमच्या जे डायरेक्टर सर त्यांच्यासाठी थांबलो होतो. ते बिझी असल्यामुळे मग आम्ही थोडंसं थांबलो होतो की ते येईपर्यंत, पण त्यांना मग ते येऊ शकले नाही त्यांच्या बिझी शेड्यूलमुळे. त्यामुळे आम्ही थोडंसं 9:30ला सुरू केलं, पण आम्ही ते वेळेत 1 वाजता आम्ही संपवलेलं आहे. आणि त्याचं प्रत्येकाने आपापले सेशन खूप छान घेतले आणि तुम्हीही कॉन्ट्रीब्युशन केलेलं आहे. म्हणजे तुम्ही शांत बसून ऐकलं नाही तर प्रत्येक CPDला मी ऑब्झर्व केलं, मी पण ऑब्झर्वर म्हणून जाते तर बघितले सगळे उठून निघून जातात, हार्डली 10-15 राहतात. पण तुमचं खरंच कौतुक, गोड कौतुक करण्यासारखं वाटतं की तुम्ही सगळे शेवटपर्यंत तुम्ही थांबलेला आहात. येस. सो 20 points. So बरोबर. The upcoming we are thinking to do on disaster management with the mock drills, preparedness for disaster management. So we can have a mock drill in that we will have a fun instead of having only lectures. It will be interactive and skill based. So that way we are thinking. So I assume you will participate in this and you will register for this CPD. And thank you so much. तुमचं खरंच गोड कौतुक करण्यासारखं वाटतं. तुमच्या ड्युटी आहे, मला मान्य, मी थोडं तुम्हाला बंद करून ठेवलं होतं, दार लावून ठेवलं होतं. आय एम सॉरी, बट सी वी हॅव टू गिव्ह आन्सर टू द MNC. Please try to understand. Okay? So now I will just hand over my mic to Vishakha.
Thank you, ma'am.
झालेलं आहे. हो, आता घेऊन जाऊ शकतात ते. फक्त मी ह्याला कुणाला जोडी बोलता का तुम्ही? कुणालशी? हां, एक सेकंड. Just vote up.
Please be seated, everyone.
Just 2 minutes. Please bear with me for 2 minutes.
Now we come to the final segment of today's program. I invite Ms. Pratiksha Giri, Faculty of Riddhi Vinayak College of Nursing, to deliver vote of thanks. Please be seated.
Just 2 minutes, bear with us.
Thank you, Ms. Vishaka. Respected Director Dr. Venkat Goyal sir, Vice President Dr. Madhvi Goyal ma'am, Dr. Aditi Goyal ma'am, Management Secretary Mrs. Dipti Dotia ma'am, Principal Professor Dr. Anupma Ok ma'am, Vice Principal Professor Ms. Usha Menon ma'am, distinguished speaker, respected organizers, dear colleagues and participants, a very pleasant good afternoon to everyone. It is my great honor and privilege to propose the vote of thanks for today continuing professional development program. On behalf of organizing committee, I would like to express our heartfelt gratitude to all those who contributed to making this program a great success. First and foremost, I extend our sincere thanks to our respected special guest observer, Dr. Aparna Shanke, for gracing this occasion with their valuable presence and for sharing inspiring word with us. Thank you, ma'am. I would like to thank Ms. Dipti Dotia ma'am and entire management committee for putting their efforts and making all the arrangement available to us. I would also like to express our deep appreciation to our esteemed resource person and speakers for the informative and insightful session. Your expertise and dedication have truly enriched our knowledge and strengthened our professional skills in nursing practice. My special thanks go to the organizer, Professor Dr. Anupma ma'am, for her hard work, planning, and coordination in arranging the meaningful program. Thank you, ma'am. I would also like to thank Mr. Kunal, CPD committee, host, Ms. Vishaka for putting their all efforts and supporting, which kept everything running smoothly. A sincere note of appreciation to the technical team and support staff who worked behind the scene to ensure the smooth conduct of the program. I also extend my special thanks to Mr. Lopez Torsi, housekeeping and canteen staff for arranging delicious refreshment on time. I would also like to thank all the participants for your active involvement, enthusiasm and commitment to continuous learning. Your participation made this program interactive and successful. Finally, we are grateful to everyone who directly or indirectly contributed to success of today's CPD program. Once again, thank you all for their valuable presence and support. Have a wonderful day ahead. Thank you.
Thank you, Pratiksha. Before we conclude the program, I request everyone kindly stand for the national anthem. I request everyone to kindly stand for the national anthem. Now I request volunteers to escort dignitaries for lunch. Participants are kindly requested to proceed towards food counter. Thank you all for valuable presence. I request all the participants after this kindly check your credit points. If you are not having your credit points, you can contact Mr. Kunal sir. I repeat, after this, all the participants will check their credit points, and if they are not getting their credit points, they will contact Mr. Kunal sir. His number is there on the invitation. Immediately it won't happen. Once the report will send from this place, you will get your credit points. Thank you everyone for your valuable presence. Have a wonderful day ahead. I request all the dignitaries and teachers, please come on the dais. We'll click one photo. I request all the dignitaries and teaching staff to come on the stage.